Good morning, everyone. I'd like to call our 2024 Town Council Strategic Planning Meeting to order at 9 a.m. on May 9th, 2024. Welcome, everyone. Before I offer some initial comments, it's not actually formally on the agenda. I do see at least one member of the community that has joined us. Good morning, Mr. Pramar, and there will be an opportunity for citizen comments now, if anyone would like to avail themselves of that opportunity, but also at the end of the day. But no citizen comments at this point in time. Just some initial thoughts before we get started, because we've got a pretty ambitious agenda. Stephanie and I talked about this. I got input from council members, and Councilmember Heidingsfelder was particularly helpful in this regard in kind of changing up how we've done the strategic planning meetings in the past. Less reporting out from staff on departmental priorities, although those will be incorporated in and reflected in the discussions today, but to have this more thematically focused on, indeed, strategic planning elements critical to the future of the town of Kiawah Island. So as everybody will note from the agenda, we do have three broad themes that we'll be discussing: the health, safety, and security of our citizens this morning, this afternoon, resiliency and protecting our natural environment, and tomorrow, planning for and managing growth. Obviously, there will be some tactical aspects to this, some of the things, near-term action items, but immediate action items and near-term action items. We want to start laying the framework for forward-looking things that we need to be planning for, and try to run in conjunction a little bit with the work that the Planning Commission is doing in developing the comprehensive plan. They spent yesterday afternoon, the Planning Commission did, continuing their work on that. As I was thinking about this, look at each of these issues through kind of three different lenses. The first one is, do we really have all the needed information, data, analysis, studies, expertise in order to make informed policy decisions, whether with regard to whether new ordinances are needed or we need to do a better job of enforcing current ordinances? My conclusion is we don't in many areas. We can talk about this in each of the subsets. We do have a lot of information. It's scattered hither and yon. Some of it is owned by the town, some of it is owned by KICA, some of it by the resort, some of it by the county, and some of it we just don't have, and I think we'll dive into that a little bit more. So with each of these areas, trying to get a better handle on whether we really know what the trend lines are that are going to impact our decisions going forward. Then the second aspect of this lens to look at this is, where do we think we need new ordinance changes? And then the final lens is, do we have, or the ordinance is okay, but the real issue is one of implementation and enforcement of things we already have on the books. So with that as a backdrop, I would actually invite comments from any of my fellow council members before we get started. Okay. All right. So let's just dive into our first theme, health, safety, and security of our citizens. And we'll talk a little bit about data, but this is one where we are starting the data gathering process with regard to law enforcement, potential law enforcement needs on the island, how best to address that going forward. We have authorized the feasibility study, so we will have a consultant to begin to gather relevant data there. We have I think everybody's seen the Washington Post story that was circulated that talked about the impact of climate change and sea level rise, particularly here in the Charleston area, 6 or 7 inches in the last few years. We also, when we heard from our consultants, both Weston and Sampson and Coastal Sciences Engineering, started talking about the modeling with regard to expected high tides, and realized that we're not perhaps where we need from an informational standpoint, given that the tides have consistently exceeded what the model shows expected. So we need to do a better job of understanding kind of where we are to be able to address some of these issues. But I think we'll go through and not specifically focus on this, but in the context of each of these presentations and discussion items, figure out whether we need more information, whether we can gather that ourselves, whether we need outside expertise in order to assist us with that. But I think we have a number of special guests with us today, and we'll first turn to our first presentation. Stephanie?
Yep. Thank you, and I'd like to thank the Charleston County EMS Dispatch, EMS, for being here today. I think one of the things in conversations is sitting around in a number of years was the level of service that we're receiving from the Charleston County EMS. I think ultimately we're very pleased with you all's service, but we just want to understand kind of dynamic. We know that we have Station 10, talk about the vehicle truck that you have stationed on the island and how that is staffed. I know just recently in the paper you all are working with our adjacent beach communities with regards to providing some additional or enhanced services on the weekend because of the tourist population. So I thought it would be a good idea just to come in, start having that dialogue conversation with us, allowing the mayor and council members to kind of talk with you, and then as we're looking at our health, safety, and needs for the community, just trying to make sure that what you're providing is adequate, or if we, council needs to talk about enhanced services, and also we may want to touch on a little bit about any type of relationship or conversations you're already having with MUSC, knowing that we have an ER facility coming here. So I will go ahead and turn it over to you. Thank you. And if you can present there, just state your name and.
Sure. I have a slight PowerPoint. Thank you. I think I got it organized where it just has a few of our presentations.
Well, what I was thinking, Michael, was that actually, after we've heard some of these presentations, come back and say, where do we think more generally, what kind of information would you think we need, or anybody else thinks we need, in order to address any of these kinds of issues? Yeah. Then we'll kind of summarize and look back, and then where do we think ordinance changes might be necessary, where do we need to do a better job of enforcement?
It would be a presentation about a handout.
I just didn't think about it.
I promise I'm not a big PowerPoint person, but sometimes it's the only way to make sure everybody's looking at the same stuff. So I apologize in advance. Thank you.
There you are, sir.
Thank you, ma'am. Good morning. My name is David Abrams. I'm the chief of Charleston County EMS. I've been in this position for 8 years. And I want to give if I may, just a quick introduction so that we kind of know who each other are a little bit. I started my career at Charleston County EMS back in 1995, and I was here for about 6 years as a paramedic. I left briefly to go to law school, so I'm a licensed attorney in Georgia. I've never practiced, but EMS law, regulations, privacy laws has been a side passion of mine for my entire life. When I came back to Charleston County EMS, because I didn't want to be a lawyer, and I wanted to find myself, I ended up starting a private ambulance company. So I got in a car accident with with one of the private service owners, and I wasn't really too happy with the way that kind of his conduct, so to speak. I believe that people in public safety positions need to be honorable and ethical and treat people with dignity and respect in all matters. And so 6 months later, we started an ambulance company called Family Medical Transport to compete against him. In that world, I ran that for 8 years, started on credit cards, and so I'm well adept to know about the private EMS world. I'm also well adept to know about Medicare billing, Medicaid billing, healthcare regulations. In the private EMS world, you deal really with the hospitals. So I am very intricately aware of Roper, Trident, MUSC, and kind of what goes on in the private sector. A lot of the private sector people do a lot of these interfacility transfers. So when MUSC builds their facility out here, vast majority of those transports will be handled by their contracted private service. Very few calls that come out of these facilities that are interfacility, where they're going downtown to be admitted, are emergency, life-threatening calls. However, if they get those, we are here and ready to respond to those calls if needed. We do the same thing with Trident freestanding ERs. We do the same thing with Roper freestanding ERs. We also do that with urgent cares. When I had my private ambulance service, I can't tell you how many times I went from West Ashley to Moncks Corner, back and forth, doing these types of transfers, the same patient populations that MUSC is going to have here. So we already have conversations and great relationships with our hospital partners to understand that we are here to serve the needs of the citizens, regardless of where they are, regardless of the scene, to ensure that the patient outcomes are as best as they possibly can be. So if we get a call from MUSC or from the new Trident facility that's going to be built out there on Maybank Road, we're going, because our interest is the public safety and to improve patient outcomes. From the outset, that is our entire goal, is to make sure we are doing the right thing for the right reason and that the public is being served. So after I sold my ambulance company, get back to that real quick, after I sold my ambulance company in 2009, I had a 5-year non-compete. I had to go away to Louisville, where I served as EMS director for another private service. Then I came back in 2015 and worked for MUSC. I managed their ambulance service when they owned it. So I'm well aware of all of those needs and the types of calls that they have coming out of these facilities. And then in 2016, I came to here as Charleston County. I came home to work with EMS. And so with that, I just want to let you know, I understand the hospital systems. I understand the private sector. I understand the calls coming out of MUSC, and I well understand the calls that need a 911 response composed of those two, which ones that do not. So EMT definition. I've given you a quick, a few handouts here. Just as a snapshot, you hear a lot of times about EMTs and paramedics and advanced. Just to lay the groundwork, there are 3 different levels of EMT recognized in the state of South Carolina. There's the EMT basic, the EMT advanced, and the paramedic. I don't want you to get confused when you hear the word advanced that they're referring to paramedics. Our medics that we have out here, you guys always get a paramedic level ambulance. You do not get an advanced, and you do not get a basic level response. What I've given you is a list of state-approved medications that EMTs, EMT advanced, and paramedics can administer, just so you get a framework of the different levels of skill and care that the patient receives. The EMT can give a lot of oral medications. The advanced can basically start IVs, but the paramedic can do all of that and also that long list of medications, majority of which are cardiac and life-saving. With that, I want to explain too, is that we firmly believe that paramedics can save lives and they can hurt people and hurt lives. We are committed to making sure anybody who is in a Charleston County ambulance has enough experience, education, and training to make sure they are only benefiting the public. We have a robust training department to make sure that people maintain that level of care. Anytime we have any issues whatsoever, if you guys have a complaint about patient care, we review it, because we want to make sure we improve it and improve what's going on. When I got here in 2016, we had 1 training officer. We have 4 now. We didn't have simulation mannequins. We have simulation mannequins where we can run a lot of mock calls to make sure that the patient, that the care people are getting is actually what we expect. So that's just kind of a quick little thing there for the EMT definitions. System-wide, We're playing catch-up. In 2015, we were running 49,000 calls, we had 31 ambulances, and we had 153 FTEs. 10 years later, we added 14 FTEs, and our budget went up $1.8 million. Charleston County EMS did not grow adequately during those years. When I left Charleston County in 2002, we had 31 ambulances. We had 13 trucks day and night and 2 at peak. When I came back here 15 years later, we had 13 ambulances day and night and 2 at peak. We didn't change our strategy about deployment. For 15 years, we are playing catch up. But through partnerships like with you guys, with Ms. Tillerson, with Craig Harris, with our hospitals, we're making an impact. You can see in 2016, Charleston County EMS had its first major expansion since its inception in 2016. Our budget went up by $3 million, our FTEs increased, but it took us a long time to get those FTEs filled. We spent 4 or 5 years trying to get that expansion completed. And then when we did, in 2021, with our call volume still going up, we increased another expansion. We added to 31, we increased to 37 ambulances, 271 FTEs, and our budget increased to $21 million. Ms. Tillerson, you were at that presentation to council in 2021 because we said there was a public health emergency. We see it, you hear about it, we know about it. But we're doing things to make a difference every day. In 2024, our call volume continues to go up, but as we sit today, as I'm talking to you, we have filled those 270 positions. Actually, Chief Bialik is over our academy. We've done some innovative things. A year and a half ago, we created an academy where we hire people to come in and train as EMTs. We pay them for that education. When they get certified, they go to the truck. Right now, we're looking at the end of May, will be a total of 52 EMTs that program will have produced in the only 3 classes. You guys have heard about our Australian program. We're hiring people from around the world. So we really do take this seriously, and we're going to make sure that we can meet the demands of the public. But right now, in next year, we'll have another 10 FTEs, 281 FTEs, and a projected budget of $31 million. That's doubling our budget in the last 4 years. You can see there are staffing hours in 2016, staffing hours. How many hours do we have ambulances staffed for a 24-hour period? It's gone from 356 in 2018 to 420 right now. So we're making improvements. In 2021, that's when we added Medic 35 here as a anchor unit. And it was, what year did we add 50 and 51? That was 2021? Okay, great.
It was actually the
Latter half of 2021. And that's an overtime unit. That's something that we're just trying to grow into. And anybody who wants to pick up overtime can pick up overtime on that unit. And so that's staffed right now about 68% of the time. And we're talking about making that a full-time unit. So KY historical perspective, this is just a total demand 2018 through 2024 year to date. So the year is not finished, of course, but you can see our response times. During COVID, we had to spike up. But as we sit right now, our response times are better than they have been since 2018. When MUSC builds their facility out here, that's going to improve our response times because that's a lot less time that we're out of the area. So real quick about HIPAA and PHI, I do have another PowerPoint presentation. This is actually just for,
Chief,
I'm sorry. Yes, sir.
Can I perhaps back up 2 slides if
Sure.
I could pose a question? This is Charleston County system-wide, correct?
Yes, sir.
Do you have a breakdown, because obviously Charleston County is fairly large geographically, and it's not, consistent population growth throughout the county. Some areas are much higher growth than others. Johns Island is particularly high growth. Population's doubled, increased about 50% in the last 10 years, and that continues. Do you have this broken down by region within the county? For example, Johns Island, what these trend lines look like?
Yes, sir. I'll make 2 points on that. First, yes, sir, we do. We break it down several different ways. We break it down by fire district, and we can also break it down by region, like municipality. The second thing I'll say is, please don't look at if we give you, say, we have Medic 35 out there, that's your only ambulance. Just the other day when I left Kiowa, I passed by the medic unit that was at Medic 7 station, which is on Johns Island across from the high school. They were coming down here to sit at that station because that unit was on a call. We have a very dynamic system, and we look at it in totality. So our units are going all over the county. So you may go in McClellanville, transport downtown, and then you may be at a Kiowa in 2 hours, staging here. So we backfill and we run that type of system dynamically. Does that hopefully answer your question? I'd be happy to provide any
Well, I
information
mean,
on that.
if you do have any additional information, I think that you can provide Stephanie and Craig and the team would be helpful, and we'll all onboard that as well. Other council members may have further questions, and we may come back to the end of your presentation, but I was just curious about
Okay.
whether you had a breakdown.
That's a great point. We'll be happy to provide that, which is a great segue into the next point, sir. So thank you.
Yeah, if you want to back up, please.
Sure.
One slide forward, please. So you were talking earlier about transfers and real emergencies, so patient being in distress. So how does that number now with the response time, is calculated? Is that including when you do a transfer from A to B, or is that only emergency response times?
So, and I do have some points later on about explaining the different categories of calls.
No, I'm talking about this line here, average RT.
Right, so that's what I'm saying, is that the average response time is everything in there. And Chief Hirschberger is the one who compiled this data. So the non-emergency, or the no lights, no sirens responses are in there. Inter-facility transfers are
So
in there.
these, what you call silent responses, they're probably scheduled, right? I mean, if
that's right.
something is a transfer from hospital A to B, or here from Freshfield Roper to a hospital, et cetera, are these considered in your world, an emergency transfer? Or is this something where, the minute doesn't count as much as if you have a distressed patient on river course?
Well, there's an awful lot of research out there that indicates that response times really don't make a substantial difference if there's 5, 10, 15 minutes difference. But to answer your question, Charleston County EMS doesn't do scheduled transports. By scheduled, and I will make sure we're talking the same language here, the non-emergency transports under Medicare's definition are ones that patient A tomorrow has to go to dialysis. That's a scheduled transport. Clearly, we all agree that's not a 911 call. But
And such would not be in either of these two numbers here.
correct, we don't do those. We only do emergency response. By emergency, what I really mean is a Medicare definition of emergency, which if you look up Medicare, it's actually immediate is the definition, not emergency. Immediate responses are those that are there when someone calls us, we have to immediately respond regardless of its lights and sirens. So if somebody calls for requesting 911 for an inter-facility transfer, we still have to get up and go, even if we don't respond lights and sirens. That is in here. For our system, about 22% of all of our calls, and this data is in these numbers too, are dispatched at the no lights, no sirens response. They're immediate, they are emergencies, but our procedure says, and the way it's coded, these are non-acute calls where, honestly, most likely days could go by and not really have a difference in patient outcomes. And that's really what we're talking about. When we say response times, what we're really saying is, how can we impact patient outcomes? And response times is the only thing we all seem to know. We think if we get there within the shortest response time, the patient's outcomes improve. Data suggests that that is not the case. There is no real correlation or causation between shortening response times and improving patient outcomes, unless some of the research shows, and I can point you to the research that they're doing, it does say that if you get there within 4 minutes, that's important. However, what really saves people's lives is pre-arrival instructions and CPR from the dispatch center to the bystander who called 911. That's what makes the most substantial difference. And once high-performance CPR is being performed for somebody having an MI, that extends that time frame of response times that impacts patient outcomes quite a bit.
It's interesting. I mean, it's a little bit against common sense what you're talking about, but
Exactly. No, and
I'm I believe you, when that's the
You're
science,
exactly,
then
that's exactly what the studies say. This is counter to what we've known
So-
since the 70s or felt since the 70s.
So then back again here, so would be able, according to also Brad's question earlier, to break these numbers down into certain categories like, with alarm, without alarm, stuff like that, so that we get a little bit better feel about, the incidences that occur on
Absolutely.
FLUA. Because some of these numbers, again, those are average numbers, but what community members report back to us, in certain incidences are numbers that are significantly higher than those.
If you look at the next page in your handout, you'll have a breakdown from 2018 to now, which breaks that down into Alpha, Bravo, Charlie, Delta, Echo calls, which is those different priorities. The Alpha calls are the ones where we're responding with no lights, no sirens. The balance of those, we respond lights and sirens and emergent. You can also see there's a fractile. Fractile basically says the benchmarks that we have put on ourselves, how often are we hitting those marks? So if we say we're going to be there in 10 minutes and we're there in 10 minutes and 1 second, we've missed the fractile. So when you look at the average, and when I got here, we were only looking at average response times. I personally don't like that as a monochromatic view of performance because it mixes too much stuff in together. We need to be looking at fractiles and breaking it down based on priority, because to me, the fractiles is really what matters. How often are we hitting those benchmarks? Not really what's the average, because there are calls that we have where we'll stage for an hour, and that goes into our average response times. There are calls that we run across where we call it in, and our response time is 1 second. It's not really it's not the best marker, but it's an indicator for us.
So just to clarify, so on this sheet, Alpha is the highest emergency level,
No, sir. Echo.
Echo, so the last one.
Yes, sir. And to clarify, echo responses may also be structure fires. All structure fires come out as an echo level response. EMS is attached to those echo level structure fires. We will go to those calls. So a lot of times, if a unit gets pulled off of that or they're en route to it and they get redirected, another unit will go to the echo level structure fire just to stand by. That still, if we reassign a unit, the original start of that call to when the unit, our unit actually arrives does count against us. So we may have a 15, 16-minute response time for an ambulance, but we reassign units, there's no patients that are identified. So that would ding against us and say that we missed an echo fractile response. But we have very few of those, so we can easily look into that and kind of get the root cause, which is what we're already doing with anything over 20 minutes, to get a root cause analysis to figure out why did we miss the mark at that level, and then how can we improve the operation. It's either one or two things. Either the demand has exceeded our resources, or we have those resources in the incorrect location. So we're trying to address those, and that's why you see, we know we need more ambulances, we know we need more FTEs. Our budget has doubled in the last 3 or 4 years. We know that our ambulance resources have gone from 31 to 56. We expect that to go even higher next year and the next few years. We know we need to do better because I don't want to have a 70% fractile. I'd love to have 100%, but right now the goal would be 90% if we can do it.
So will you,
What would happen if there are two life-threatening calls at the same time, one on PO, one on SeaWorld? How do you handle that?
That's a great question. It would really be, we may get calls coded at the same level, but our crews have MDTs, so we are actually reading what the call taker on the 911 call is reading. So we would make a decision based on where the units are located and what the actual complaints are of the patients to determine who is actually the higher priority, even though they may still be within a Charlie level or Delta level call.
But let's say they're both very urgent calls. How do you service both of those needs?
Well, I'm not, and it does happen. We do get multiple calls out, yeah. And it's a hypothetical, so, that's one of those things that we would have to, generally what happens is the unit first assigned to a call, if they're of equal value, would still stay on that call. And then we have a supervisor who is right up the road who would respond. If we have medic 50 or 58 here, they would respond. But the next closest unit would start heading this way, and our supervisor would start heading this way as well. So, and the fire departments, of course, would be responding as well.
I just was going to ask about the fire department. I thought that was going to be one of the answers. So, with respect to your training categories that you talked about, first EMT, advanced EMT, what level of training is the fire department person?
So I don't like to really address fire departments. I'd like to direct those over to the fire chiefs because they're the experts in their individual departments. We work with 17 different fire departments within the county, and each one of them have various levels. But what I can tell you is I believe that the St. John's, and just to make sure again that we're on the same page, as EMS does own all the medical calls within the county. Part of our partnership, though, and I talked about that at the outset, is that we have great relationships with our fire department partners. They are integral in our response packages. By response packages is, if you look at the Alpha Bravo Charlie Delta Echo, there are dozens of subsets in the dispatch center programmed into the computer. Based on how it's coded with set questions that are nationally approved and accepted, they will code something as a Bravo level 4, so to speak. That says what resources get dispatched on the call. It may be 2 engines, an EMS supervisor, a battalion chief, and an ambulance, or it might be a call that just says we just need an ambulance with no fire resources.
Got it.
Through partnership, we've all agreed that's how this is going to happen. So on those calls, like you're talking about, high acuity, I was assuming it was a given that the fire department's responding.
Understood. So final question is, how do you then determine, since you're servicing all hospitals, which hospital you go to? That's just more of a curiosity.
It's a great question, and it kind of goes into when it comes to healthcare regulations and law. So we believe that the patients have an absolute right, I shouldn't say absolute, patients have a right to determine their healthcare provider. I believe that's a federal law. I believe that's kind of at least best practices. So if you want to go to Trident from here, we're going to do our best to accommodate that. We have people all the time that want to go all over the place. We try to let the patient determine where they want to go. However, if you're having, say, a stroke or a heart attack and you really need a facility that can service that, and you want to go to a facility that can't, for instance, if you're having a heart attack and you want to go to the freestanding, we're going to tell you the freestanding does not have a cath lab. We should go ahead and take you on downtown so that they can actually do that. That's going to be the best for the patient outcome. And so that's what we're going to talk to you about. If you don't want to do that, we're going to contact if you want to go to the freestanding or go to a different facility that doesn't have those types of cath lab facilities, we're going to contact the ER physician at the facility you want to go to and most likely get orders to divert under a physician's order.
Got it.
So that's kind of how we operate that. We run into it all the time, but our goal is customer satisfaction and patient outcomes. So we don't want to take you and wouldn't take you to someplace that we thought was going to hurt you and harm you, because that's a lot to explain to somebody who may not be in the healthcare industry when they're having substernal chest pain and they really need this facility to save their life and they want to go to somewhere else because it's close to their family members. So we have, and that's where the experience comes into play. That's why we don't just take somebody who just got out of paramedic school and put them on the ambulance and say, go have at it. It takes a month for them to go through our orientation program here. And even then, another 6 months just to get their endorsement to be in charge of the truck. And even then, rigorous reviews and quality assurance with our training program to make sure that we're maintaining that level of expectation and that discretion that you just so described, that they have that discretion to know that what they're only to do is help people and not give a medication or do a treatment or not do a medication and not do a treatment that's going to harm people. That's why I can't stress the importance and the necessity to have, with Charleston County, 50 years of layered experience within our system to make sure that we have the best outcomes for the patients we serve.
Great. Thank you so much.
You've talked several times and said 3 or 4 times, response time is not a function of patient outcomes. So 2 questions. Can you sort of define what patient outcomes is? And then you did say that pre-arrival instructions are the biggest determinant in patient outcomes. Talk to us about the training for folks who give those pre-arrival instructions.
Thank you. It's a good question. And so just to clarify, I'm not saying response times are not linked to patient outcomes. I do believe that there are other reasons to have response times, maybe not an alpha level call, but we want to get there as soon as we can for any call that we have. And what we think is, even though I'm quoting what the research is, what researchers are saying, I'm not saying I agree with that, because there are other factors, aren't there? It's not just about patient outcomes. There's public perception, public obligation. We don't want people waiting 20 minutes on an ambulance. Like, those are the things that mean a lot to us as well. It's not just about what the clinical data is showing on research. When I talk about patient outcomes, what I'm referring to is we want to maximize patient outcomes. And patient outcome to me is I want people to be discharged from the hospital in the healthiest, least impactful way where they are under some type of medical emergency. So if you're having a heart attack, I want you to have as much much cardiac tissue when you get discharged from the hospital as is humanly possible. So when I'm talking about patient outcomes, I'm talking about how can we maximize the health of the patients who are being discharged, and is there anything that we can do on our end to make sure that we can shore that up and make sure that we're not a cause of any exacerbation of any medical problem, or of heart dying, or renal insufficiency, or in stroke situations, or the brain matter dying. So, and then
Pre-arrival instructions.
pre-arrival instructions. So, and again, I don't run the dispatch center. Director Lake, Jim Lake, runs the CDC, but they do an amazing job of pre-arrival instructions, and I can't tell you how important that is. And the only message I can send, because I don't have data to support it, I'm not going to speculate on things I haven't read or familiar with, but I do know that when we're responding to a call and people refuse to do pre-arrival instructions, it makes those patient outcomes, it does shorten the survivability, and it does decrease patient outcomes.
Okay. Okay, can I ask a question? First of all, to Ross's point, we had that discussion in the CTEX meeting about, how many of the fire personnel have certain qualifications. There is a certain amount of fire personnel that has an EMT level. They're currently working on the advanced EMT level. And there's a small number, but hopefully soon to be increasing number of paramedics on the fire trucks as well. Depends on the shift, the shift assignments. So what you approved on Tuesday as part of our CTAX package was actually to help the fire department, the St. John's Fire Department, to pay higher wages for those that fulfill the qualifications. So if you have regular fire personnel and you go through these courses to become either an advanced EMT or even a paramedic, you are expecting higher pay, right? So what we approve is helping the fire department to actually incentivize the fire personnel to go through these trainings, and when they are finally, are approved, they are, I guess, eligible for higher pay, and the money that we gave them now, is going to help them to pay adequate wages, which also will help, hopefully, to increase the number of qualified, medical, trained personnel on these fire trucks.
What a great idea. I'm all for it. I'm glad I.
So that is one thing that helps, because according to what exactly the chief said, the first response, the quickest that people can be there, and our fire department has response times between I think an average 3 and 7 minutes, depending if you're including fresh fields or not. So they are usually the first ones on the scene. Okay. So my other question would be, I think we're kind of starting to settle that response time does have a little bit of an influence. So,
I totally would agree with that. That's just what the studies are suggesting.
Your scientific data seems to suggest something that is against human logic, but somewhere in the middle, it is certainly not
Right.
wrong to look at these response times. So when I look at your data in this one sheet that you provided us with, and intentionally I'm excluding 2024 here because it looks like that's only the first quarter probably, and that's the most quiet time we have on the island. So I'm not sure that the 2024 data is representative. But you have now, when I look at 23, response times between 12 minutes and 15 minutes. Unfortunately, the 15 minutes is for the most severe cases, obviously. So you mentioned earlier that you have something like an objective or a target or a benchmark that you measure yourself against. is that for all of Charleston County, or is there also a target for Kiowa that you seem to or want to achieve? And how far are we away with these 2023 numbers to your target?
So these numbers are county-wide, correct, Chief? Yes, sir. Yeah,
They're
okay.
even countywide. So then, when we go to these numbers here,
To clarify, the goals themselves are countywide. The actual data provided here is isolated to Cuba.
Oh, yeah, I'm sorry, yeah. Let's look at the incident number.
so
incident numbers, yes.
is this now county or Kiowa?
That's Kiowa.
That's Kiowa.
Yes,
That's
sir.
what I thought, exactly.
Thank you,
So
Chief.
when you look at these numbers, and then what is your objective for, or target, or whatever you call it, for Kiowa in terms of response time?
Great.
There is, well, we have a combined fractile that we would like to get there 90% of the time, meet the goal 90% of the time. However, I believe it's the first or second page where it has Alpha Bravo Charlie identified.
They don't have the full packet there. No, because I didn't want to overload people with,
Yeah, so for example, alpha responses, we have a goal being in there at 15 minutes or less. Bravo, 13 minutes or less. Same for Charlie. Delta and Echo responses, we want to get there at 11 minutes or less.
Okay, so for the Delta and the Echo, which are the more severe ones, if I understand it correctly, you are 2 to 5 minutes away from that objective, which
Or
is...
if you're looking at 2023, I believe you're correct.
Yeah, I mean, again, I want to look at 23 because 24 is probably just the first 3 months, and that's the most quiet time we have on the island, so it's maybe not representative for this year, and that's why I wanted to look at 23. So you're somewhere between 20 to more % away from your target for Kiowa at the moment. Is that a correct
So more
statement?
standardized goals.
Yes, okay, good. All right, thank you.
but I will say this is reflective of countywide as well. So this is not just something isolated to Kiowa. And just for the people who are listening and may not have heard Chief Hirschberger, the target for alpha level responses is within 15 minutes. Bravo and Charlie is within 13 minutes, and Delta and Echo was within 11 minutes. And those are the goals we'd like to hit 90%. It's an ambitious goal because again, we have to our units have to be positioned in a way that we can get there within 10, 11 minutes of any call that comes out.
Chief, we've got a pretty ambitious agenda. I don't know how much longer you had in your presentation.
Not long, sir.
Okay. We wrap that up and then come back a little bit to maybe some opportunities to follow up and get some of this more granular level data, particularly relevant to Johns Island.
Sure, yes, sir. I'll expedite the balance. So just real quick, HIPAA, as far as sharing the data, we don't mind sharing that stuff with you guys, but again, when it comes to HIPAA though and PHI, I just want to throw this out for you, is that there are certain amounts of data that we cannot share with you guys. If it's identifying a patient, the address, even saying we responded to an abdominal pain on Kiowa is too much information because you can identify with less than one call a day at Kiowa who that could be. So any data that you're looking for, we're going to have to make sure we scrub that and make sure that we can protect the public and your citizens to make sure that we don't breach any of that protected healthcare information. When it comes to HIPAA, this is from the Medicare guideline, just to let you know, when it comes to the data and the protection of the patient data, Charleston County EMS is the only one who bills for those services, so therefore we're the only ones who are obligated under HIPAA. So Charleston County EMS owns all of that data. So the fire department can't release it. Nobody else can release it. We have to be the ones in the authority to release it under federal law. And this is just a breakdown. I think we've already talked about this somewhat ad nauseum. As you can see, the raw data. And response times, we had a good conversation on that. As a profession, we need to unwind the clock and focus on things that truly make a difference in patient outcomes. That's from the Journal of Emergency Medical Services. Pretty good article. It cites multiple studies that have been out there that talks about that if we're going to really talk about patient outcomes, let's don't really necessarily talk about response times because that also involves traffic accidents and such as well that increase the risk, as well as just the outcome data. So the focus is not on response times, patient outcomes, as we've talked about. It is a factor, not a determinant. So we agree that it is a factor, even though, because it makes sense. National Health Institute study concluded that emergency response teams should look beyond the response times in their effort to improve patient outcomes in cases involving cardiac arrest. We already talked about that. Really what they're talking about, pre-arrival instructions, the sophistication and experience of the medical crew, especially the ALS providers that are responding to the call. And then the factors in patient outcomes, again, we've talked about that, pre-arrival instructions, our partnership with Barrier Island Resources and advanced life support, paramedic level advanced life support to get them all the information they can respond to calls and provide life-saving care. Partnership with St. John's Fire Department, when we promote them getting the advanced EMT, we're here to support their efforts. And so we talked about the MUSC and Trident additions. And then I was just going to ask if my deputy chiefs or assistant chiefs had any comments that they could see, observe. Thank you.
Question?
I have one more question.
Go ahead.
So you were talking earlier about, how you guys collaborate between EMS and the fire, and I guess that's happening in the dispatch center. And I assume, looking at experiences that I was told and data, et cetera, that I was able to look at, that the fire department is usually the first on the scene, just because of their proximity, right? And their much bigger staff on the island. I would
Well,
say.
they have a different purpose too, which is to respond to structure fires, lower insurance rates and such for
Exactly.
For
So,
houses.
and I think my impression, at least talking to people, also in the fire department, that this seems to work pretty okay today. I think there were some rough patches in the past that I've heard, but I think that works fine. What I was puzzled with is that, and that's very specific for Kiowa, of course, we have beach patrol that actually are contracted by the town and serve as also kind of first responders on the beach or beyond, right? They're all extremely well educated. But I heard that there is either not enough collaboration or it takes a longer time for them to actually be notified, because they could be on the scene even much quicker than your guys, because they're patrolling every day, during at least, daylight hours, on the beach. They can be, very quickly at a scene. So where is that collaboration, and why does it seem, at least by what I was told, so tell me if I'm wrong, that there's a little bit of area of improvement?
Yeah, and what I will say though is that I'm really big on partnerships, and you asking me that question directly is what I encourage every one of you to do from now on. If you have any questions whatsoever, ask me or ask Ms. Tillerson. I promise you she will dig into and get any answers you guys have. But I open the door to ask any questions you guys want. What I can tell you when it comes to Barrier Island, Rob Edgerton used to work for Charleston County EMS. I have a wonderful relationship with Rob. I fully support them getting NDTs, the CAD data, response packages, whatever we need to do to get them the information as soon as we can and the resources so they can respond with that paramedic level care. We are 100% behind it, at least from the EMS department. If there's resistance, I know there may be some out there, but it is not coming from this department.
Are you saying now that our beach patrol is notified at the same time as the fire department?
So I can tell you my understanding is that Beach Patrol has radios and they're dispatched over the radio at the same time that EMS and fire are dispatched. I don't know if there's a delay or what you may have heard. That's my impression, and I have no more information on that if there is.
Without being able to resolve this problem here today, but
Right.
I would really appreciate if you would, because I appreciate the approach that you're taking here. I think it's absolutely the right one, that you might want to look into this and make really, really sure that our beach patrol receives any notification from a dispatch center of yours at the same time, as the fire department, so that they can decide, if it makes sense for them to send one of their vehicles to the scene, just to be, again, they are earlier than you guys
Right.
can be because of your locations.
Exactly. So no, I appreciate that. And again, we've added Barrier Island to our response packages that we talked about earlier. So they should get automatically dispatched. And you're right, this goes back to response times and accessibility of that ALS care as soon as we can. And that's what I mean by trying to improve patient outcomes. If it improves patient outcomes, I'm behind it. This is not about egos. This is not about ownership of any geographic area. I only want one thing, and that is improved patient outcomes for everybody within the county. And whatever we need to do it, we're going to do it. But we can only do it, we have partnerships with people like yourself and with Rob's team and with the St. John's Fire Department. So that's what's exciting to me, and that's what's going to be our success as a community working together, is to make sure that our public gets the absolute best medical care in the pre-hospital setting that is available in the country. And I would put us against anybody in the country, response times included.
It's just a follow-up to Michael's question, and you may not know the answer, but I've heard the same thing Michael has, and what it comes down to is a call goes into 911, and then 911 decides, I think, who to call, or how does that work? I call 911, say, I'm on the beach, there's a problem. How is that dispatched?
So again, I don't want to.
And can there be improvement, to Michael's point?
Right, yeah, and so what I can tell you is that that's already predetermined. So the dispatch center uses, and again, I don't want to talk about Director Lake's department, but I used to be a dispatcher years ago. I used to be an EMD, an emergency medical dispatcher. And they have what's called the ProQA card. So they used to actually be physical cards. I think they're on the computer now. But when you call in, they have set questions that are nationally approved. When they get down to the bottom of that, what they call ProQA, it identifies a Bravo level call. It's a Bravo level 4 call. This is the response package. Chief Wynn has helped build. I think Chief Bialik helped build as well. I mean, it's pages and pages and pages and pages of just different resolutions of what subcategories of these calls are, and then what the response package is. And response package means who's going. So we don't decide that as calls come out. That's predetermined and pre-agreed on. A lot of the fire departments have asked to respond to a lot of our medical calls. We've allowed that, even though it might not be medically necessary. But we do think it's important to visibly be there and have responders on scene as soon as we can, regardless of the patient outcomes, because that's what we're here for. People call 911. We want to be there as soon as we possibly can be.
Luke,
But
I
it could-
talked to Rob from the Beach Patrol about this, and he said he receives the 911 calls on the island the same time as the fire department or the same time as the EMS. And if it's within his area of coverage, he then automatically goes. But he does receive those calls.
And they're authorized to respond off-beach?
First, yes, and matter of fact, he's told me they have before, because commonly they'll be at a location, at a boardwalk location or whatever, and a call comes in off the beach, and if he's there, he's going to respond.
So I think we don't want to further speculate here, because I heard exactly the opposite, that it takes them 10 minutes or more to get actually the information. So
That's not what I
let's
heard.
leave it as we said, Chief, that maybe, you need to go through these pages and pages of packages and make sure, because Kira is so unique in that respect, that in these packages, the beach patrol is always included, right? So that they can make, or actually you make decisions for them, if I understand it correctly, that you dispatch them because they're probably in the closest proximity of everybody.
Yeah, it is a
So if you want to
partnership
check
with,
that
yeah,
and just make
will do,
sure
yes, sir.
that you guys and the fire department and the beach patrol are really closely coordinated so that we get some of these experienced personnel to the scene as quickly as we
Right.
can.
But you said you didn't want to step on Mr. Lake's toes, so
Of course. Well, I don't
who
want to, I want
can?
to make sure I stay in my lane, and I don't want to be, I can
don't
be
know
a
if that-
subject matter
Mr.
expert for
Watson?
EMS, but we can verify that.
I can tell you that.
Mr. Watson, if you can state
Oh,
your name for the record.
This is
I
my boss.
come to speak, but I'm just here to support my guys. I can tell you, Mr. Mayor, that our dispatch center has a multi-layer of protocols to follow, and it's established by a board. Barry Island Beach Patrol is not a part of that board. It's fire, EMS, and fire chiefs, and our EMD department. I can tell you that communications between EMS and dispatch and Rob team is great. So I'm not sure where the miscommunication is. Based on my conversation with Rob, Director Harris, there's no issue. I just signed an IGA authorizing EMS to give additional data, information to the Barrier Islands to improve on the overall response. Because the Barrier Islands is a key. Those guys are uniquely positioned on the beach, better than fire and EMS, to respond to calls much quicker than EMS and fire. So we'll make it a point to get Rob and his team
any and everything that they need.
And is there an appreciation within the system that Barrier Island, while they're spending their time on the beach, they're, you know, a couple of minutes away from areas off the beach as well and are capable of responding to those?
Well, that's up to Barrier Island. So their responsibility is strictly the town of Kiowa. So all depends on the town's agreement with the Barrier Islands. Dispatch will not dispatch the Barrier Islands outside the town.
I appreciate that. I'm just saying that if there's an incident, something occurring elsewhere on the island but away from the beach,
Yes,
dispatch
yes, sir.
understands that they can respond to that.
Yes, sir, my apologies for that misunderstanding, yes.
So, again, I want to clarify this. So when you say dispatched, that means that your dispatch center tells them where to go, or are you just relying or relaying the information to them, and then it's up to them, their own dispatch, the Barrier Island dispatch, to
Right.
decide if they want to send somebody or not?
The Barrier Islands have access to the MDTs and our CAD notes. So as Dave just said, we establish protocols. And that package including fire, law, EMS, and the Barrier Islands are part of that response package. So if it's a jellyfish bite, Barrier Islands will respond. EMS may not respond. All depends on the outcome on the information retrieved from the Barrier Island Patrol.
But we have a cardiac arrest at the river course. Okay?
Yes.
And the closest personnel with experience is the fire department and the beach patrol, because you guys are 10, 15 minutes out, as we saw in average. Are they getting a call from you guys, from your dispatch, from your organization, saying, could you please go?
Yes, St. John's Fire and Barrier Islands.
They both received that instruction.
Yes.
So how many
And
times-
EMS is also responding to as well.
So, exactly. So how many times has, if you know that, has the dispatched, the Barrier Island team?
This is the thing,
on here?
dispatch do not directly dispatch the Barrier Islands. In other words, our dispatch center do not contact the Barrier Islands person with the radio and say, respond to Beachwalker Drive. It's a part of a bigger package that they're included in, where they're part of that package to respond.
So what you're saying is they get notification,
Yes,
but then it's up to them to decide
yes.
if they go
pretty
or not.
much. Yes, sir.
Thank you very much, both of you. It's extraordinarily helpful. I appreciate the spirit of cooperation and collaboration and partnership. I think we all do. I think that if it's okay with you, Chief Abrams and Mr. Watson, that there may be follow-up information. We'd love to just kind of nail down some of this. In particular, with regard to your county-wide data, if we can come back to you and get a better understanding of what the current resource deployment is on Johns Island and, immediate Kiowa area, and this is a strategic planning session, what your strategic plan is with regard to resource deployment, allocation of resources and resource growth in this area over the next 5 years or so. Given, we've got Kiowa River coming online, some growth here, Kiowa River State's going out, new developments coming in. There's a lot of growth on this end of the island. We'd love to see how your plans match up with that.
Yes, sir.
Can I just add one thing, just one quick question that I know we get a lot of questions about is how does the truck on the island, how is it manned, how long is it there? And also how often is there? And I know there's been conversation from St. John Fire that they would like to be able to, I guess, transport.
So one of the benefits of, that the fire has is that they don't have to transport. So when you transport, you lose that resource for 2 hours. That's why we're looking forward to the freestanding out here, because we're going to shore that up quite a bit. So the ambulance out here at Bennington Station is 24/7. It does not go unmanned. It is a priority staffing unit. So that's a paramedic level unit. And when they do a transport into the city or wherever they go, they are knocked out of service when they clear the hospital. They are not available for calls, and they come back out here. That would be both of them, actually. If they're both up, that's how that happens. So we don't use them in other areas unless, of course, they're the closest resource to an echo level call.
But they are gone for 2 hours.
They are gone for 2 hours. But we also backfill.
So if a call comes in within these 2 hours, your response time skyrockets because you have to bring in somebody from Maybank and River.
No, sir.
And Maybank and Mohican, right?
No, sir, not necessarily. Just like the other day when I left here, the medic unit got a call, and I passed the medic unit that was at the Johns Island station. I passed them going back here to backfill. So when the call pops
So that's
out,
the-
we
the
have resources.
dynamic system that
That's
you
the
were talking
dynamic
about.
deployment. And
So
so,
this unit that we have on Station 6, so how many, what's the percentage of presence? So, I mean, and yes, including if they have to go somewhere. I mean, I don't mean presence in the building, but
understood.
from a 24/7 kind of
Their
look
availability.
at, what is it, 50%, 60%?
So this unit over here is a 24-hour shift.
I mean,
Well, yes, sir, and that's 72 hours off, so 24 hours on. This unit over here is the 12-hour unit. It is only right now, as you guys know, when you grow a business and you grow a company and you try to, expand, you have to do it in certain ways as you expand, and that's what this is over here. This is just to me about muscle growth and about improving the responses. So that's only staffed by people who are not on the regular schedule who want to pick up an extra overtime shift. So right now, it's about 68% of the time it's staffed.
68.
68%. But that's also an extra unit as opposed to this other one that's 24/7. So Kiowa, 68% of the time, has 2 ambulances for about 1 call a day from the system. So you guys are about 0.3% of our total call volume in a day. But what's changed for us, though, is that you guys have expanded so much towards the golf course that response times, just by nature of how Kiowa is designed, creates that challenge to make sure we have a presence out there. So, and I know you guys are cramped for time, but our 5-year plan includes making that a full-time, 24-hour scheduled, 72-hour shift, just like this. So both those units will be 100%, because we're going to need the redundancy with the expansion of Seabrook, the presence out here of assisted living facilities, and the growth that you guys are experiencing just like everybody else in Charleston.
So 5 years is a long period.
Well, well, I'm not saying we're doing it in 5 years. I'm saying within the 5-year plan.
So when are you doing?
Right now, the next stage is to have a unit for Wadmalaw and a separate, this is this summer, Wadmalaw unit, and also a separate unit to come back over to this area, which we call a zone coverage, which would cover Ravenel, it would cover Kiowa when the medic unit's out, to give us more resources south of the county, so that when calls do pop out and Edisto gets a call, we have a unit to backfill. When Kiowa gets a call, we have a unit to backfill. It's more resources. So the takeaway is, in 5 years, you're going to have more resources than you have today. We're going to have a bigger budget than we have today. We're going to have more ambulances, more FTEs than we have today. Just like in the last 4 years, you've seen how much we've grown. We're going to continue that trajectory.
You also indicated that the cycle time would be reduced once MUSC's standalone center and the Trident Health complex comes online, because you're not transporting for as
Correct.
long a period of time, you're back on station more quickly.
Yeah, and just for reference, 94% of all of our transfers to a hospital are done with no lights, no sirens, because they're not acute medical emergencies that are life or death situations. And we can manage majority of those. So only about 6% are transported lights and sirens. Those 6%, the reason why I say that, those 6% are usually having the heart attacks and the strokes that would probably be transported downtown for higher level of acute care.
Are there other ambulance services, privately owned, for instance, that are called upon to help you in an overflow situation?
Yeah, and again, that's like I said, I don't have an ego. I care about patient outcomes. So there are times where we may have a void because we have a lot of calls that come out, say in Mount Pleasant or North Charleston. And if we have a private service that can respond with one of our supervisors, we will call on what we call mutual aid to help respond and shore up some response times and handle patients to be transported to the hospital. So we do rely on and have a good partnership. About 30, 40 times a month, we may rely on mutual aid. We also call Hanahan EMS, Berkeley County, Dorchester. And in turn, we respond mutual aid to them too. We respond when the private services can't get to their contracts for acute care calls. We respond to Berkeley County, Dorchester County. We all help each other out, and that's the benefit of the partnership that we have, not just with our surrounding counties, but also with our fire department. So partnership to me is the only way to go in this region.
Thank you all very much. Very informative and helpful. Thank you. Do we want to go one more topic before? Well, that's fine. Perhaps, let's talk about water quality on Kiowa Island. And I'd like to turn to Councilmember Berner to kind of kick off this discussion.
All right. The water we receive here in the island, it originates from the Charleston Water System, that organization. It is then transferred through Johns Island Water Company, and then ultimately it comes here via the Kiowa Island Utility. So I go through that breakdown because that means our water source is ultimately coming from the Charleston Water System. Recently, the Charleston Water System has said their level of PFAS, or forever chemicals, is above the EPA limit. So they're going to be constructing a filtration plant to bring the levels down into compliance. But what that means, because it's going ultimately to the Kiowa Island Utility, the water we have now must then be above the EPA limit. We've been asking Kiowa Island Utility to provide an answer to whether our water is safe or not. I mean, two basic questions. Is the water safe or not? Second question is, if it's not safe, what can or should we do as a town, or what should the individual community members do? And we haven't received an answer to those questions, which makes me rather suspect. So one of the things I was considering is the town would retain an engineer that would help us navigate through this challenging question, tell us whether or not we do have a problem, and then what we should do about it. And so that is the kicking off point for this item of discussion during the retreat here. So that's my introduction.
Jim, perhaps you can chime in here as well, but, and I know the town's done its own water quality testing. Some of our council members have done their own water quality testing as well.
Yes, sir. I actually prepared slides on this topic. So I'm going to run through those real quick, and hopefully that'll answer your questions here. Let's see. Oh. There we go. All right, so I don't know if I need to bore you with all the details of these chemicals, but obviously widely used in a lot of applications, mainly due to their unique ability to resist heat, water, and oil. And obviously, right, we all know there's a lot of concerns around these chemicals. They last a long time in the environment, and certainly been linked to health problems as well as issues in the environment. So I probably don't need to get into all these details, but obviously we can be exposed, people can be exposed to these PFAs through drinking water, like Councilman Berner just talked about, as well as through eating certain foods, like fish from our ponds likely contain these compounds. Get it from the air as well as the soil, and from products that are packaged or made with PFAs. So just public health impacts, there are a lot of scientific studies out there that link these compounds to a lot of issues with public health. I won't list them all, but they're up there for you. Increased risk of cancers and reproductive impacts as well. From an environmental standpoint, these compounds are called forever chemicals for a reason. They last an incredibly long time in the environment. And take a long time to break down. So, in terms of direct environmental impacts, I don't think we completely understand all of the impacts, but there are a lot. They can certainly build up and bioaccumulate, and end up in a lot of the things that we eat or drink in the environment. Real quick on the new EPA guidelines that just came out in April of this year. So it targets, I think there are 25 to 30 different PFASs or PFAs out there. And so this mainly focused on, the new regulations focus on 6 or two primarily that are the biggest cause for concern. These are known carcinogens, right? We know that they have significant issues for public health. And those are PFOA and PFOS. And so the limits that the EPA has set for those are effectively 4 parts per trillion. That's basically what water companies and water providers would have to adhere to, but their goal is 0, right? So they'd like for these chemicals to be completely out of everything we eat or drink, but that's a huge challenge. And so the enforceable levels are set higher than that. And so these 2 compounds are classified as hazardous substances, and so water utilities have to start monitoring and publicly reporting PFAS levels by 2027. So currently, water companies do not have to report levels of these compounds. Charleston Water System does. They do that voluntarily, and a lot of water systems do, but it will be required starting in 2027. And then utilities and water providers have to be in compliance with limitations by 2029.
Charleston County reports, do we know what it is now, the rate?
My next. So my
And
next
the max
slide.
is supposed to be 4.
Yeah, so I've got those numbers for you in this incredibly busy slide. You know, you can't be a scientist and a biologist without having a very busy slide with lots of data on it. So kind of walk you through this if I can. So these are the 25 compounds, 25 PFAs that we tested for in the water supply here at Town Hall. And then the 4th column is the most recent voluntary testing by the Charleston Water System. So hopefully you can see all of that, but the 2 most important ones I want to point out are the ones that EPA now has requirements for. So
But Jim, in your prior slide, you were saying that PFOS and PFOA, the recommendation from the EPA is 0, and you're stating here 4 ppb.
the enforceable level is 4. So utilities and water providers will have to adhere to the 4 standard, but in a perfect world, they would like all of these.
I understand that,
Yes.
but we are currently discussing about, you know, what is really the impact or the risk here for us and everybody, actually in Charleston County, right? And you can look at it 2 different ways. You can look at it, what is technically possible to impose on the water manufacturer, so to speak, and what is the desire. So when I go by that, the statement here is maybe not 100% correct for the PFOS and the PFOA, because yes, technically, you know, feasible is 4 ppt, but the recommendation from the EPA is clearly 0.
Correct, absolutely. You know, we would, in a perfect world, there would be none of this in any of the water or food that we drink.
So that means from the roughly 9 compounds or whatever you want to, materials that they tested, I believe, more than 5 are either above EPA recommendation or very close to it.
Yeah, so the
Correct
EPA
statement.
recommendations are really only, well, the only 2 that we have up here are the PFOA and the PFOS. And so if we just look at those, so PFOS, our garage faucet was 5.68, the town hall kitchen faucet was 6.2, and then the most recent testing by Charleston Water System in May of 2023 was 5.2. So obviously all of those are above 4. And then PFOA, the garage was 3.12, town hall kitchen was 3.34, and Charleston Water System's own testing was 4.2. So they were over the level in their testing, even though ours came in under. And so, you know, there's a number of these that we picked up that, for example, Charleston Water didn't test for, that are at pretty high levels. So PFBA, we were close to 4, but it was not one that Charleston Water System tested for. So. Yep, and that's the other one. So the filtered water station right out here between the bathrooms, no PFAs in that, so you can drink that freely. So I just have kind of one more slide. So the testing that we performed, we deliver that to General Engineering Labs here locally. It costs $320 per sample, and it tests for the 25 PFAs that were listed on that last slide. And our results are pretty comparable to what Charleston Water System, came up with in May 2023, which is no surprise because we're getting our water directly from them. But obviously the water that we get here is the same that every resident on Kiowa is getting right now. So, most kitchen faucets in all the homes out here are going to have PFAs at very, very similar levels. Right, if they don't have filters. And so, I just threw a few bullet points up here for discussion purposes, but, the need for additional testing. One thing that we have not done in the past, so we test fish out here on the island from a variety of ponds that are recreationally fished, and the fish are often consumed. We test for heavy metals and pesticides. We've done this for 15 plus years, but we've never tested for PFAs. And so I think that would be a good thing to do, to understand, what the levels are in fish that are being consumed. Right now we don't have any advisories on consuming fish in our ponds based on heavy metals and pesticides, but I'm sure that there are PFAs in the fish on the island, and getting a grasp on that would be good. I know Brian's already looking at a filtration system here at Town Hall, so that we can, take action here. And then another, potential discussion point is engaging with KIU on the cost of, voluntarily reducing PFA levels through some additional treatment, even before the EPA regulations go into effect in 2029, if that's even feasible.
And Jim, when you talk about filtration systems in the homes, are we talking about a GE filtration system in the refrigerator that filtrates your normal, very basic water supply? Or are we talking a more extensive, expensive system that goes on the faucets?
Yeah, I think that I haven't done a lot of research on this, but I think refrigerator, your normal kind of screw-in water filter in your refrigerator likely filters 95% or more of these compounds. And so, for example, at my house, I have a 2-stage filter underneath my kitchen sink. It's like $100, and it, states that it filters 98% of PFAs out of the water. So it can be filtered at individual faucets fairly cheaply. But obviously, like having an entire, complete home filtration system is going to be in the, thousands of dollars.
Well, one thing that is working for the town is, you said whatever is coming out of the faucet in the kitchen area is pretty darn clean. So could you let us know what that is, so we could perhaps consider implementing that?
No, it's not the kitchen, it's this one here.
The
between-
water-
Oh, this one here.
In the restrooms.
Okay, so, all right,
The
so whatever
automatic-
that filtering system is that the town is using, can you let us know what it is then?
Yeah, I have no idea. Brian might know.
It's a basic, just LK is the brand filter that we use. It's very, very similar to what people would screw into their refrigeration systems at their homes. It's not a complex system. I think you can get a 3-pack of them for like $200, and they last. It's based off of how much water is filtered through, but typically we swap ours out maybe every 6 months.
Should we let
Community know that? Should we do an
Well, I
e-blast?
think that's what we wanted.
I mean, that's what we are discussing.
Just talk about,
So
yeah.
to Madeline's question, so I have a complete filter system in my basement that filters every liter of water that comes into my house, and extracts 99.65%, I believe, of PFAS as well, which is another, additional filter in my basement. So I have a little chemical filter system factory in my basement. It's about $8,000. So, but that filters every single piece of water, so for your shower, kitchen, everything. If you just want to have one faucet in your house that filters to that same level, then it's about, I think, $800. At that high level, if you're satisfied with like 98%, it's like Jim said, it's between $300 and $500. So it's reasonable. I have to talk to my filter company again. I had a brief conversation. They actually are starting now to have general contracts for municipalities at special prices, which is still not much cheaper than the numbers that I gave you. But obviously, they are engaging with municipalities and counties, et cetera, to provide their residents with, a package that is, more slightly lower than for the general public. So that could also be something for us to consider.
Well, clearly, we can't do anything from a regulatory standpoint. We cannot control impose on the water companies, otherwise we won't get water. And they don't have to comply with anything, as you noted, until 2029. It's at that point in time where, and then even then, they only have to meet the 4 parts per trillion
Correct.
standard. There's no obligation to get to 0. So the question is there a role for the town in providing more education and information around this? One question is, do we just periodically say the town test at the town hall and report levels so people have that information and can decide what they want to do themselves? The testing at the town, as you know, shouldn't be really any different than testing at any other faucet anywhere in the island, because we all get the water from the same place. And then the second level of question, apart from whether we want to or feel we should educate and inform about these issues, is do we want to go a step further and start either suggesting, recommending filtration systems or solutions, and then even a step further, whether at any point in time the town wants to have a role in subsidizing or something, which I suspect is, maybe a bridge too far right now, given where we are with our testing.
I think we have a responsibility, first of all, to inform, right? So I would suggest that maybe Jim can find a little bit of a simplification of this, not hiding, but I mean, maybe we can take out all the NDs and focus on those that, had results and then explain, right? I think we have an obligation to inform and provide the data. That's my first point. Second point, I think we should, also because, $321 is not huge, so we should continue maybe on a quarterly basis or something to test the water. And then again, publish in a hopefully easier to understand way, the results. I would recommend, though, that we are not only looking at this from the municipality center, location, but also to go maybe to other locations on the island, because at least my filter guy said that, the levels can be different because of accumulation in the pipelines. And the smaller the diameter gets, further out, et cetera, or the water flow, that can have an influence. So we might, at least for the next 2 or 3 quarters, 4 quarters, at least to check at other locations and see if there is a notable difference, but publish it.
That makes sense, because
And-
we have 2 different sources of the water coming in. There's another entrance. somewhere.
There's another entrance, but still, I mean, they come from the same source.
understand.
But you never know how much buildup are, in these systems. And what worries me the most, actually, is that I've learned that our water company does what they call kill shots. So a kill shot is a 5 times higher chlorine level in your water at certain times of the year. They usually do this for two reasons. A, they do it before the peak seasons, especially before the summer and before Thanksgiving, before Christmas, before Memorial Day. They have a certain period of time where they obviously push, far higher chlorine levels through the system, which then results into a lot more stuff that ends up, for example, in my filter, because basically this cleans or clears some of the pipes, and then you get a huge spike of stuff that ends up in your filter. And that would also wash, the PFAS that might have accumulated in the pipelines to, be not broken down, but be delivered. So we might not also have a constant level, but, certain ups and downs depending on these kill shots. And they do the kill shots as well if they actually find contaminants in their regular testing. And here in South Carolina, they're not required to immediately issue a hot water boil advisory. They can actually go through 2 or 3 of these kill shots, and if nothing changes, then they need to issue a hot water boil recommendation. So that means that we also face several times a year these extremely high levels of chlorine in our water, which is another element that's problematic. But independent from this, I think we need to inform, we need to test, we might need to do something as a communication piece to explain what are the different options without, of course, referring to any particular brands, but what are the options, how our residents can deal with it.
Yeah, and without referring to specific brands, I think that that advice coming from Jim would be appropriate. I would want to know what the town biologist has to say and what your kind of broader recommendations would be about, as an individual homeowner, I'd like to know what you think, where it makes sense to put in a filter, and which range of filter might make the most sense.
So do we know, is it possible that the EPA or DHEC or somebody already has some, explanation of different filtration systems so we can point to something governmental?
Yeah, I don't know, but can certainly look into that, for sure.
I'm not sure that we should make recommendations, because I don't think that we are,
No.
required or even in a position to do so. So when I said earlier, inform the community about what are the different options. I mean, you can go from this easy one to, a chemical factory in your basement. I mean, these are the different options.
My only point was there may be DHEC or some other governmental organization may have already said, here are your different options to reduce, and these have different levels of effectiveness.
Yeah,
I
and
don't
here's
know,
the
we should
link
just
to
look at
that
Yeah,
source.
link to that. So it sounds like that what we will at least want to do is periodic. I don't know quite, quarterly or something, the town announcement to say, we're undertaking a water quality testing program. We'll monitor, report what Charleston County, Charleston Water is saying. We'll say we'll do our own testing here at the town hall, and then maybe one mid-island site, one eastern end island site, and I don't know if we could cooperate like with either the resort and or the club. You could do it at Ocean Course and one of the clubhouses, Mid Island, or Q Island Club, Marsh House.
St. John Fire Department.
Oh, that's right, St. John. That would actually be the easiest way to do it. That's a great suggestion. So maybe at the 2 firehouses.
Yeah, assuming they're not filtering their water now.
Oh, that's right, assuming they're not filtering, and then,
Well, yeah, that's true.
yeah.
Okay, I can
And
make
then,
that happen.
so you raised another good issue. At the same time, what would be involved in doing some fish testing? The concern there is every pond's going to be different.
Yeah,
is
so-
that going to be, useful information with regard to one pond that's carries over to other ponds?
So for 15-plus years, we've tested fish for pesticides and heavy metals in the most commonly fished areas on the island. So
Okay.
that's like Beachwalker County Park, not Beachwalker, but the pond on Beachwalker, Canvasback, Egret, Pintail, Willet. We actually also test fish from the creeks on the eastern end of the beach because that's an area heavily fished by residents. So we're already doing the sampling, so
Okay.
it would just add 300, like, we currently are paying about $283 per fish to test for heavy metals and pesticides. So adding this would just, it cost us $600 a fish, or $650 to add on the PFAS testing.
So we're not testing for PFAs right now, that's?
No, we never have. But I think it's
So
obviously in
it
light of
doubles the
this.
cost per fish. How many fish are we?
Typically, we test 15 to 20.
Okay.
So we're not talking about a lot of money, $5,000 or $6,000 in addition to our normal fish testing budget, which we normally, so historically, we do it in the months of October and November. And so we get, 2 to 4 fish from each of these ponds, and then we test them once a year. And we historically split that cost half and half with the community association. So they help with the collection, and then we basically split the cost of the lab work with the KICA. So assuming they're willing to add on this testing, we're only talking about an additional $3,000-ish.
Have we ever pushed out the information, apart from PFAs in fish, have we pushed out any information around other contaminants in the fish?
I mean, we haven't historically pushed out actual levels, but all of our levels are below the DHEC, basically fish consumption advisories that they push out for other public water bodies. So we've never had anything alarming.
But have we even pushed out that information?
It's been a while, but historically, we would push it out through eBlast. The town and community associations just finished their fish testing.
So if we,
It's been a while.
maybe in the context of some communication coming up around water quality testing, mention that we're also have been and will continue to do annual testing of fish, and that we'll provide that information as well, but we might note in that previously there has not been any issue.
Yeah, we can at least push out now last year's numbers, and then in December, I would assume, or January, the next wave. But I also think we should communicate that, because it's a good news. I mean, if everything is normal or, in green, then we should communicate that as well.
Both good news and the fact that, that the town is paying attention to these things for the benefit of its citizens.
So Jim, do you know these fish that we're testing, are they pretty much stuck in our ponds, or do they go in and out to the ocean? Any idea?
Yeah, so certainly fish move back and forth through the pipes and, from time to time, but probably most of the fish that come from the marsh come in as smaller fish, and then they grow up and live probably their entire lives in our pond system. But there certainly is some movement back and forth.
Okay. I was just curious, so we're testing then pretty much the quality of our pond water rather than the ocean or the bays, the river.
Well, yeah, I mean, other than the east end, right? When
I
we're
just was
testing
curious.
fish out there,
Right.
those are living in entirely, but all of our ponds, with the exception of, I think maybe 4 out of our 100 and something ponds, are all connected to the marsh.
So the fish may not move, but the water that they're
Right.
No, I understand.
living in.
Yeah, there's water moving into the pond system from both ends of the island every day. And the ponds in Tennis Club and Turtle Cove, right? Those are closest to the center of the system, and that's why those ponds are really fresh. So we've got freshwater ponds in that part of the island, and then everything else is brackish and saltier as you get closer to where the water comes in. So those areas don't get as much exchange with the water from the marshes and river, as opposed to ponds like Canvasback and Egret and Pintail and Willet and Beachwalker that are directly connected to the river.
Sure. Okay.
But with those, more frequent rain events, we also have actually more rainwater that goes into the ponds. washing over streets and driveways and whatever. So we also, I think, have, with these rain events, an increased amount of contamination that goes
Sure.
into the ponds.
There's a lot of chemicals on the
So
golf
that's why,
course.
you know, these testings, I think, is even more important than they have ever been for us, so.
Yeah, I agree.
Okay, so I will work on quarterly testing here, Mid-Island, Far East. We'll add testing for PFAs to our normal fish testing.
Communications.
And we'll communicate
And
this
Jim, I would
testing.
think that, you know, one location here to test and one at the fire station, one at the fire station is enough. I mean, we don't have to go through all
Right.
those three just for one
I
facility.
just wanted to add the garage because I've been
yeah.
drinking that water unfiltered for
No, but I mean,
years.
the difference, there are differences, but they're not.
Sure, not-
you know,
not huge
significant. So I think if we are testing one, maybe you pick one that had the highest results and go from there.
Sure.
This
Makes
way,
sense.
the testing would be the same cost each quarter like what you have now.
Sounds good.
Thank you, Jim.
Break now?
Yes, absolutely. 5, 10 minute?
Sure. Good plan.
emergency preparedness. Number of aspects about this, and, hurricane season and what have you, but last week, the town hosted a tabletop exercise. And I understand, I think Todd will bring us up to date on what transpired there, but the idea was that the mayor declares a storm-related emergency, high-impact storm. It's something like 5 o'clock, 5 a.m. in the morning, and then all of a sudden, all the different relevant entities are activated, and I guess we'll learn about how we dealt with that.
As best as I can.
Okay.
I'm Todd Kaminsky. I'm under Craig. I'm a poor understudy for Craig's, but I will say that is close to what the scenario. That actually, this scenario that we had last week was more for the town staff, preparing town staff. We had three groups, four groups essentially: the assessment team, the planning, the communication and operations teams, comprised primarily of town staff. Basically, it went very well. The scenario played out, and basically the assessment team would go out and do its preliminary assessments after the storm. And then once the storm is passed and we're doing the assessments, during the storm, the operations and logistics and communications teams are all interacting as the assessments come in terms of roadway, if we're road passages, if something's blocked, homes that are damaged or destroyed, whether it's minor or affected. But it went very well. A lot of areas that, working together with everybody in a real in a simulated situation as we did, it really helps to see how everyone interacts with each other in their different positions and how they need to communicate, how the communication is done, and how the information is passed on to fulfill with the resources that we may need as a community. I'm sorry, what was that one more time?
How do you coordinate with Kika in terms of emergency preparedness and response? And where does your boundary stop, unless it just stops at the first gate?
Probably at the first gate. That's what I'm assuming. But we are going through, I'm sorry, Bruce.
Would you like for me to address it a little bit?
I was going to say we are having a countywide, which is going to include all the entities, Kika, the resort, on June 5th.
Mm-hmm.
But
Yeah. So just a little bit to add on to what Todd has said in regards to the emergency preparedness. So where Kika is that once the governor, as an example, governor declares an evacuation order. The mayor then has the authority through an MOU to essentially close the gate. Then the responsibility is shifted over to the town. Kika acts as a support through their security or whatever we need support with, but then the town takes the lead once the governor declares an evacuation order. During our training that we always have typically Kika's involved through their land management people, through their security people, and Shanna's typically involved. If we ever have to evacuate, normally the people that we take to the evacuation becomes the mayor, sometimes the mayor pro tem. I go, finance goes, communication goes, and the COO go. We go off. We leave the town. If the governor issues an evacuation order, we have to leave. We're leaving. That group of people is actually going. We already have through finance. We have established locations throughout the state and even into Georgia. Depending on where the storm's coming, we evacuate to those areas. We have the other council members, as an example. I need to know where they're going in case we have to vote on something. But who's actually traveling with me are those individuals who I just named. Once the governor has officially lifted the evacuation order, we have our damage assessment team, to include Kika. They are essentially ready. So when the storm passes, they're ready to come onto the island to determine the condition of the island. They're then reporting back to Shannon, at this point, Shannon and myself, letting us know the condition. I am then reporting to the mayor, because the mayor's with me. Shannon's reporting to her board chair, who's typically not with us, but she's reporting. We're letting them know to say, yes, even though the governor has lifted the evacuation order, Kiowa may not be ready to open up because we need to do some cleaning up. So we're advising the mayor in terms of if it's okay to open, or we may say, we need to stay closed for 3 or 4 days because we have a lot of cleanup to do. Then the mayor keeps the island closed. So that's kind of so with Kika and the town, it's very much a partnership, but once the governor issues that evacuation order and the mayor then essentially takes over, the mayor then essentially takes over from an emergency standpoint, and the mayor is the one that closes the gate. So it's just a
But
process.
a question, and I didn't recall, and I was only there for the very beginning, that it was a evacuation order scenario. It was, the one last week, as opposed to just.
That's normally what the scenarios we're running, no?
I didn't think it was. Yeah. So that's what I wanted to just make sure we understand the distinction between, this was a high-impact tropical storm event that led to island-wide flooding, I think some significant property damage, and so, but that's not.
So everything with the exception of, then we still have an MOU with Kika in terms of if it's like a 1,000-year flood or the nor'easterner type flood. We're not really at that point. We're still working with Kika. We have not activated the mayor's role to be able to close the island down. It is really just in terms of, you guys did the scenario, was the scenario where the island was closed, but it was not an evacuation.
The mayor, I guess, issued an emergency declaration, correct? That was the scenario?
There was no emergency declaration.
Yes. No, because normally the governor issues the emergency declaration.
No evacuation orders. We had over 3,500 residents on the island, and that was the scenario to work off with the approaching storm.
So it's just essentially like a normal nor'easterner or a 1,000-year flood in terms of the town working together with Kika. At the end of the day, what we're trying to determine is probably, I would imagine, what are we going to do as staff in terms of the flooding situation, and then more importantly, how are we going to address after the fact? So when the storm passes and there's debris on the island, how do we execute or activate our debris monitor, if we, I don't know if this scenario, debris monitoring and debris removal. Kika also has a similar contract with the same company. We then, if they're going to activate theirs, we activate ours, depending on the nature of the storm. Kika then may decide that, or between the town and the association is typically where the mayor and the board is talking with Kika. We determine the nature of the cleanup. It could be that we have an MOU with Kika that we can go back behind the gate, the town can do initial cut and toss. We can get reimbursed for that. And then we may decide that Kika has the team and the staff to be able to do the rest of the cleanup, and then we're just going to focus on the public areas and the beach. So I'm guessing, depending on the nature of the scenario, I don't know if that included the actual debris removal, and if it did not.
Not this scenario.
Okay.
It was just mainly like blocked roads, homes.
In which case,
St. John.
John's, they've got the resources to barricade roads that are flooded, or if there's trees down, they can barricade those. But they've also got chainsaw crews that can clear roads, and then also informally, whoever is behind the island or behind the gate, he's not going anywhere. He's the first person. You know, if it's 3 o'clock in the morning and the storm's gone, he's out. He's out.
And he's who?
Gary Otter.
Gary Otter.
He's a contractor on the island. Primarily works for the resort, but he's his own LLC.
So I think, I mean, it's great. So I think we put together a number of these scenarios. We work with the county doing the scenarios. We do our own scenarios. And we're essentially getting ready for the hurricane season that starts on June 1st. And hopefully we don't have an early
June
storm.
5th will be the actual scenario with the all-county.
Okay, and June 5th would be one with the Charleston County Emergency Management Division, where they're going to come and essentially test us. We're going to run through this scenario, and they're going to essentially grade us in terms of how we do with regards to when the storm occurs. I don't know if you guys are aware of this. Council chambers become the MEOP, and the MEOP is just the Municipal Emergency Command Center. And the MEOP typically involves some of our staff that have roles. I'm involved. We have then meetings where we bring our partners, which is we have representatives from KIU, the resort, Kika, Freshfields, and Berkeley. They can come, St. John Fire, CCSO, and Kiowa Partners. They're all invited because if there's a real storm, our MEOP opens up. We have to do a call-in with the county because all these other municipalities and counties and other jurisdictions are calling in. We're reporting on the storm. The governor has typically a call before we do our call, but everyone around the table is listening on the call because we take the lead. They're listening on the call, and then after the call, we just ask if there are, any needs, unmet needs. Do they need something? What can the town do to try to help support them? So it really becomes a real all hands on deck effort. And fortunately, when I started in 2015, we had the 1,000-year flood, and probably every year thereafter for maybe the last, except for last year, maybe the following year, we haven't had anything. So we've had a lot of practice. We've evacuated, I think, 3 times. We've had a number of named storms. So as a group and entity, we work fairly well together, and we kind of know what to do. But we're constantly learning every year, and we practice every year. And that's why we have disaster awareness also to help educate our citizens because the routes change. And so I think we have new routes, hurricane routes that we're going to push out. So we do this training.
Two things.
Yes.
Could I or we get a copy of the memorandum of understanding with Kika?
Yes.
Is that what we're going to do? Mm-hmm.
Well, the MOU is not based on the exercise. It's just something that we've had in place since I started. It's just an MOU, yeah.
I'd love a copy of it, so I understand who's saying and doing what. Number 2 is there an emergency operations or preparedness manual that kind of has all these steps and who's coordinating?
We have one, but in all the years now, we have it. We had a consultant when I started, came in and provided one that was this thick. And when the storm actually happened, it really was kind of thrown out the window. And it really was because it should only been maybe this thick. So we do have one, just so and we do, the first one was probably about this thick, yeah. The new one, yeah.
I'm looking for the practical one, the one that says,
The practical one, I have to see if we actually drilled it down. The one that's very thick is very good, I would say would be very good for someone that doesn't know the process. But I'll look and see. I have the thick one. I don't have the drilled down version, but we'll share with you what we have. Mm-hmm. Yes, yeah. I'll see if we have
how
that one.
things work, not the whole history of everything, but just really who's going to do what, who's in charge of what, who's going to coordinate, how it works is the important part.
Mm-hmm. Yep. Any other questions for Todd or myself with regards to this? And I know one of the things we have on here is and the path to accreditation. That's a very, very long path. I meant to take that out. There's something that Director Harris will love for the town, and it would be the town as a whole. And essentially, it's accredited through, I believe it's like under FEMA, federal accreditation. Yes. But it is something that, and maybe Charleston County EMD may have this, probably even the state. It's something that probably can take years to get. So this is just I think a very aggressive goal to have. It'd be great for the town to have. It would just essentially say that we're accredited for any emergency, but that's just something that is.
Do we know what that entails, what that means, what it takes to get it, and does it
Well,
have any benefit for us other than just saying,
I think it does
somebody
have,
really thinks we are prepared.
I think it may have benefits, I just don't know those
It does.
benefits.
Craig has that
Yeah,
information.
yeah. So that would be, I would imagine that would be pushed out and discussed through the Public Safety Committee.
Okay, because, I mean, the fact that it may take a long while, this is kind of what this
Right.
meeting is all about, trying to map out what are
Right.
those things
Right.
that we need.
Yeah, and I would say through Russell chairing Public Safety Committee, that'd be something that, if they'd like to create a subcommittee to really look at it, to see if there's something the town should do, because it's my understanding this could probably take 2 to 3 years, maybe, to get this accreditation.
Yeah, I think that's important too from a standpoint, what I'm thinking about is, are there lessons learned? Are we keeping track of the lessons learned? As we think about resiliency of the island, like I'd never seen, I haven't been here that long, but us take sea marsh around because of the flooding on Keel Island Parkway. But things like that where we can identify problems from storm to storm or event to event, where we can plan for how do we correct that in the future, would be something to be of great interest to me.
Yeah, I would probably say that's not going to be part of the plan, of our plan, but that's something that I think we could add it as part of the discussion. But in our normal plan, it really is, I would probably say it's more of, depending on what type of event you're having, what steps that you need to take to essentially make sure that the town either stays up and running, either here or off-site.
That's what I'm
And-
thinking about. What are the responses that kept the town up and running? And is there something we can correct or prepare for in the future so that the resiliency of the island is better as we go forward, rather than always responding the same way and doing the same
Right,
thing over
right, yeah.
And my question would go exactly in the same direction. So with the fact that we have seen an increase in number of storms, named storms, tropical depressions, etc., how good are we actually to learn not only from our own experiences, but especially from other experiences? So just 2 examples. Captiva in Florida was hard hit by one storm last year. Very similar setup, right? Single bridge onto the island, that actually was destroyed. Heavy flooding, heavy destroyed, structures, roadways, etc. The same probably with the North Carolina Outer Banks. So have we actually reached out to those municipalities to learn from them what have been their lessons learned,
We have not reached out.
especially post-storms?
We have not reached out to them post-storms. We did with Hilton Head when they had Matthew. One of the things that we have is that we have a company called Philip and Jordan. We already have a plan in regards to if the bridge goes. If the one main bridge goes, we already have set up to bring in a temporary bridge. We already know how long it would take to bring that bridge in. We've talked about the cost of rebuilding a new bridge. Those are things that we have already put in place with regards to.
I'm aware of it, but
Yeah.
my question really is, the only way for me to sleep well at night is not only that we are doing these tabletop exercises, which is good, don't get me wrong, which is great and very important, and also these, preparedness weeks and exercises you do on a broader scale. But what are they worth, the exercise and the outcome if we don't really permanently, clarify, are they actually still, entailing everything we are going to face? And that's why I thought that it would be, helpful for us now that some time has passed since the storms last year, to talk to, for example, Captiva as a municipality or some way of
Right,
government
right.
organization, to better understand how have they prepared, how have they managed during the storm, and how have they managed afterwards, and then make a comparison saying, are we covering everything that they have experienced and they learned, in our scenarios and in our setup?
I would say that we can probably make sure it's memorialized, but so that you sleep well, the answer would be yes. We have prepared, we look at those things, and the reason why we do is because every year we go to the hurricane conference, either the governors in Florida or we go to the other one in New Orleans, and we are talking with other jurisdictions that have gone through this. They're giving they have best practices, they give lessons learned, and I know Brian and Bruce and Director Harris, they go to those. I've went to one. So hearing, I know just some of the things that I've brought back for what I've learned, I said, have we looked into doing certain things related to storms? I know maybe Brian or or Bruce. Bruce, you're always coming back with ideas. If there's anything that you guys want to quickly touch on, that lessons learned from those conferences from other communities. You have to speak either in the mic or, because it's kind of hard to hear you.
So the topic on lessons learned, let's take the 1,000-year flood, for example. So during the 1,000-year flood, what was discovered was we had a number of homes that actually were flooded. These homes were actually ended up on a repetitive loss list on FEMA's radar. What was discovered after the storm, and wasn't known prior to the storm, was that we had some stormwater piping issues. Some have collapsed, roots have gotten through some of them, and those have since been repaired and taken care of, and we've had no flooding issues even from storms moving forward. So that's just one example of, what came out of a type of storm. When you talk about going to the governor's conferences, and you're looking at every state has a representative there. Most municipalities and cities and counties have representatives there. It is a networking event. A lot of times, like Captiva you mentioned, they, during these hurricane conferences, will actually do presentations on lessons learned. So a lot of areas, especially, unfortunately, Florida gets hit a lot, especially in areas in Florida, these jurisdictions actually will have a presentation for you, and you just go to that event, and they go through every best practice, what they did wrong, what worked for them, what they plan to do in the future. So you get that information. You try to come back and incorporate that information in what you do during a storm. But yes, we go back, and obviously we have the MEOC set up, but after the storm, there's a debrief. What worked, what didn't work, where did we have problems? We take a look at that, and that's all the entities. That's not just us. That's KICA, partners. Everybody's looking at that same scenario going, what worked and what didn't work? What do we want to change moving forward? So why we don't necessarily have that written into an emergency manual, that process is done and it is written down. It's just, it's not an emergency manual. Your manual is just something, hey, we're going to do this, this, and this. It doesn't get into the weeds necessarily. What gets into the weeds is basically our records that we have from various storms that say, hey, this worked and this didn't, and we need to make changes. So we do
Michael,
that.
I attended the tabletop exercise last year. It was a lot of fun and very interesting. The tabletop exercise is dealing with the emergency situations as they unfold. It's more of reacting to the hurricane as it goes from level 1, 2, 3, et cetera. And they get all the parties involved in how they're going to, save or protect the community. What you're referring to, though, I think is a fabulous idea, and I'm gonna follow up to find out, using your example of Captiva, what are they doing different now that they didn't consider or think of before the storm? That's something that I think we should grab and implement here. Because we haven't gone through that kind of learning curve yet, but some others have, and I think it's. I'm going to make sure that happens. I'm going to get that information.
And first of all, I'm sure you guys do debriefs and what's so not is necessary. So I'm not worried about that. It's more those little experiences that others have made.
Exactly.
Right? And
We don't have to make the same
Captiva, of
mistake.
course, came to mind because they are exactly the same like us, right? They are surrounded by water. They're close to the shore, but still surrounded by water. They have one bridge, one road that goes east and west, and that's so it's very comparable. But the interesting part that I thought we could learn maybe from them is that, okay, what happens after the storm? I mean, you cannot prevent the storm. We all have our plans to evacuate the island and so on and so forth. But then what happens right after if the bridge is out, right? So would they, for example, now, very simple example that comes to mind, store bottled water on the island, already on the island, you know, so that when emergencies, personnel comes in, et cetera, that there are some resources. I mean,
Something already there.
sometimes these little things can make a huge difference, and learning from them, you know, can be big. And I'm sure there's great learning from them in these conferences. But I think we all been to conferences, and we all know, you know, what are the benefits are really of those kind of things
You raise a
compared
good-
to sitting down with them for a day, maybe on the side of these conferences or the day before, day after, and really have a detailed conversation about what their experiences are.
It's a good point. We do, FEMA prepositions assets in advance of a storm.
So just so you guys don't, so you guys don't get in, so through, the town has done this exercise. We've done it with Philip and Jordan. They are our company. Not only do they remove our debris, but they have an extensive list, because this is not their first rodeo. They go around and do storms. We have an extensive list that we have with them to say, one, if there is, say, their evacuation, we have another Hugo. One, there's no one else on the island, so we don't have to really essentially worry about residents. But we have it already set up that through the mayor and then council, we've said we would not charge for business license, but we want to be able to get people on here to start working. So we have, through our reserve fund, that's one of the reasons we have that, is because how long can the town essentially operate financially without bringing in revenue? That's one of our resilience that we always look at. Through Philip and Jordan, again, they have this list that we have for no water. They would bring in water. They would bring in food. We have the packaged food deal already with them. We have the tents. We have the bathrooms. We have already checked all the different things through working with them, going through the scenario that if we're hit with the Hugo and the town needs to operate and this facility is gone, we can bring in a temporary facility. That would be the cost for that. So we have methodically gone through with them and worked with them to say, what are the scenarios? What's the worst case scenario? We need to still operate. How can we still operate? If for some reason we don't have power, we have the electric vehicles. That's why we decided to keep gas vehicles. So we have, as much as we can, through lessons learned from other communities and through Philip and Jordan, help guide us in terms of these are the things you need. If you get hit with like a Hugo, we've said, if you're on Main Road and Bohicket and it's all blocked, what happens? Well, the nice thing is that they have a contract with the county, so essentially the county may activate them or the state as well. Essentially, they would start working there and then they would work their way down. So we have worked through a lot of scenarios. Of course, there could be something that pop up. They were sitting around the table going, we didn't think about that.
Again, nobody in this room would want to question that you guys are not prepared, right? Then you have gone through all these scenarios. We are all aware about the bridge deal and everything else. It's just those little things sometimes that can break.
Well,
right?
water and resources in the
So, I mean,
situation,
just,
and,
you know, if an outcome of a conversation, a detailed conversation with Captiva would tell us, guys, we are prepared. Everything we can do is already in our plan. Wonderful. Then we can sit back and relax. But maybe there is something that we can learn, right? And maybe there is something that they were really struggling with, because I'm sure they also had plans, but they were maybe struggling with the fact, how am I actually getting people that need to be on the island onto the island if the bridge is gone? Right? What are boats? How do we have a ferry to bring over, you know, heavy equipment?
We looked
I mean,
at,
all of these little
we've already
things.
looked at all that.
So-
But yeah, but what I think what we can do is sit down and probably memorialize this, because a lot of stuff that you're bringing up, we have looked at. Because we have talked about, already looked at different locations about bringing, that you want to. I have to speak in the mic.
I think your question is going towards asset mapping of what we have locally. That's what I've gathered listening. So part of our exercise in ICS is expound upon every local resource that we have before we tap into either county or state resources. So as part of that process in our exercises, we did recognize in our debrief that what we need to initiate this time around is ensure that when we reach out to St. John's Fire, Kika, and know exactly what resources as far as how many boats that we would have access to in a short period of time, that we can know exactly where they're staged or I think that's what I've been hearing you. I was just trying to make sure I understood.
Just as an example, okay? I mean, I'm really not an expert in this. It just keeps my brain running. Just want to make sure that we are not overlooking something, that's all, right? And that we are looking at this always with this attitude of hope for the best but plan to the worst. So what John said, we might know that there are certain boats on the island, but what if they're all destroyed? Right? Or we have certain trucks on the island that we can use, but what if they don't start? I mean, these things, you know, we might be able to learn from others a little bit if they really matter or not. That's all I'm saying.
The other thing that, and Michael and I are totally in sync here, the other thing I'm thinking about is Captiva operated for about 3 months with no connection to the mainland. So what if we had to operate for 3 months with no bridge? I know you're going to say Phillips and Jordan are going to come in and put a temporary bridge, but if a storm hits that wipes out ours, it's probably going to hit a couple of other places, and their resources might be. So it's that type of thing.
And
It's the
we've
second
talked about
iteration
that.
or the third iteration of the plan and the what-ifs.
Yeah, yeah. And I get everything you guys are saying, and we've talked, and maybe it's a little bit of trying to pull this all together, because we did talk about that. We said to them, hey, this is along the coast. What happens if other people are out with the bridge? So we've talked about that, and it is that, okay, we have, essentially what they said is that we'll get a bridge. What could happen, though, is it could take, instead of being transported here in 2 to 3 weeks, it could maybe take 5 to 6 weeks. But that's,
I think that what Michael's suggesting is a terrific idea, and it can't hurt. They might be very interested in sharing any lessons learned with us. There could be things that simply haven't been thought of, and what's the harm in setting up some kind of a Zoom meeting?
I think what we're hearing is that the staff would do that, along with probably the Public Safety Committee, and we're not saying there's any harm. We're just saying that a lot of these things we've done, and we can look into other communities.
Everybody
Yeah,
acknowledges that.
yeah, and we can look
Could be other
into,
interesting things.
yeah, and we can look at other communities to see what the things, you know, specifically meet with them, because we may have met with them at the conferences. But I think bringing them in from Hilton Head to Captiva to yeah, there are going to be a number of communities to say, hey, what lessons have you learned? And they may have their stuff written down, they can pass it on to us, and we can look. And the nice thing could happen is that we can check the boxes and say, we're right where you're, you know, we've already thought of these things, or maybe 1 or 2 things we haven't thought about that we can add in our tool kit as storms happen. And one thing that we also learned is every storm is different, so you plan, like you said, you plan for it, and then one thing happens and you didn't plan for it, but.
Like in
If
war.
I may,
It's like in war.
if I may, typically prior to storm season, around this time, I do have a meeting with our contractors. We've got 2 debris management contractors and a debris monitoring contractor. Typically have meetings with them and look at, how we're set up and anything that we can improve on from lessons learned that they've experienced in different municipalities. So I'm happy to bring these questions to them to clarify all that. How are we going to escalate from local resources up to state resources, and just making sure that all those boxes are checked.
Very good. Anything further on this subject? Moving to the next agenda item, pedestrian safety. 2 or 3 different components to this. One, fellow council members have been working on getting blinking lights
Yes,
at the front main gate intersection.
that is correct.
There are ongoing issues with regard to particularly crossing KIP around Kiowa Beach Drive coming out of Oyster Rake. And then thirdly, wanted to kind of tee up the issue of whether we need to look more broadly at pedestrian safety issues on the island, and particularly given the fact that there is no kind of easy ingress and egress for pedestrians and arguably folks on bikes as well from the left side, the north side, the west side of KIP and all along until the Vanderhorst. And Vanderhorst, the second gate. And you know, because I think we've all probably driven along and just see people standing there, getting ready to try to walk across to the leisure trail, to move towards the beach. And, you know, how do they do that? We don't have crosswalks. Should we have crosswalks? Should we have additional signage? You know, what are kind of the obligations of drivers and pedestrians? And there isn't any clarity on any of that. So those are kind of the issues to tee up. I want to start with where we are on the front gate.
Well, the front gate was supposed to get blinking lights by now. And
Not the front gate, I mean.
I'm sorry?
To be clear, it's the leisure trail crossing
Yeah,
of
in front
Beach Walker Drive in front of the intersection.
Right, at the crosswalk. And we were going to have activated lights that would require drivers to stop when the light is activated and somebody's in the crosswalk. I assume there would have to be a slight amount of training, if you will, of our residents, that when they see the blinking light, that you're not to keep going without a care in the world. So you'd have to slow down at the very minimum, but expect the plane to stop. With respect to your comment for crossing over Kiawah Island Parkway at the intersection where the road going down to Cougar is, that's
Kiawah Island Beach Drive.
Beach Drive, right. We were also going to put in blinking lights there too at the same, because that is a very congested area. We were going to use those two as test case. We also wanted one at Sorel because we noticed that, or at least I noticed that there's many times a backlog of people trying to get across, and it's very challenging for them. But we're going to use these two examples to see if it's going to work or not. The signs are taking forever to get here. We thought they'd be in by now, and
So the problem is that we probably made the wrong decision to say we want to collaborate with KICA very closely and do the same thing at the same time at these two intersections as a test case. Now it turns out that the Oyster Rake, Kiawah Beach Drive crossing is highly complex technically, right? Because you have a multitude of, first of all, geographically challenging because of the curve shortly before. Then you have the middle island, so you basically have two crossings and 3 streets coming in, 4th even if you want to include Oyster Rake. So this has become technically in terms of how all of this needs to be connected, you know, wirelessly or with cable and have power supply, etc. It's all have become far more, you know, complex for KICA to accomplish. And the first quote that came in, which already took a long time, but, you know, based on the engineering recommendations that KICA received, the first quotes came in were extremely high. So now they're challenged with, you know, okay, how are we going to do this? How are we going to fund this? And although Tony Elder is giving me the input that, you know, he's progressing, but we don't really know how quickly this is going forward. So I think we are at a point where we might want to decide today to say, let's move forward, because so different are these signs not, and we know how KICA wants to establish that. Now Seabrook has given us examples of these exact crossings where you basically just push a button, the lights go on, you cross, and the lights are on for a certain period of time depending on the length of the crossing, and go out and then you continue. So it's a rather simple thing if you just have a one-street crossing. So we might want to decide today to just say, okay, let's move ahead because, you know, the high peak season is approaching and we want to safeguard this critical crossing and gain experience from it if it's something that we also need to do in other places. Okay, you're talking about Kiawah Island Parkway. Well, that's more in the jurisdiction of KICA, of course, but we also have on our properties other crossings which are, you know, critical. There's another one on Beachwalker Drive further down towards Beachwalker Park that might fall into this category. We certainly have an issue of bikers and pedestrians currently want to go before the bridge over to the existing boardwalk where we have nothing, not even a warning sign that traffic, I mean, foot traffic or bike traffic could occur there. So at some point, I think we need to make the decision of moving forward.
I think we have to make that decision to move forward on our own. I've been meeting with Tony on other safety issues, albeit within the front gate, particularly along Surf Song, where the road serpentines a lot, and there's a lot of blind corners, and there's a lot of cars just out of their lane and getting into close head-on collisions. I've been talking to him for a year about this, and I just don't understand why he can't get safety things taken care of. I just don't. And so it seems to be a common theme that we have. Kika doesn't seem to be willing to move forward on certain issues, so let's just do what we have to do on our property and show them this is what you have to do.
So Brian, if you could help us where, I mean, my last understanding was that we know what we need. We know the source that Kika is potentially using. We also have other sources, I think, that you mentioned to me that we can tap in. So from your point of view, if we would make that decision today to move forward for that Beach Walker Drive intersection, how quickly could we implement that with all the proper signage, you know, the ARB-approved signage, et cetera?
It's a good question. So ahead of this discussion and kind of my thought process being that we might want to move forward independently from the community association on this, I have sent over our plans and specs for these signs over to an electrician that can do turnkey solution on this. So it's in the hands of that company right now. I'm expecting to have a quote and lead time given back to us next week, hopefully next week. So I'll have more information for everybody then. It's not a terribly extensive project. We've got power right across the street. Actually, there's power adjacent to where the sign will be on the corner of Beachwalker Drive. So it shouldn't be terribly intrusive and extensive for us to get that operational. But again, for this meeting, I don't have a lead time, but we can anticipate it being pretty quick, assuming that the cost isn't an exorbitant amount, at which point I can reach out because we've gotten some specs. Dylan from Kimley Horn has helped us out a little bit in some of the design, and he's got contacts in the industry that we can utilize and ask questions to them about too.
And Mark, I see just before you come up, you made one interesting comment, Michael, that I've heard as well before, that because the roads are behind the gate, that Kika controls those. Those are privately owned roads, but those are within the municipality. I believe that the town, the municipality, could establish traffic regulations. So if we wanted to require stop signs at every intersection or require crosswalks, that would be within the municipality's police powers.
Yes. And we have thought about that, Russ and I, but we said, okay, let's test this, see the reaction of the community, is it really helping, et cetera, gain experience with it. And I'm not worried about it because other municipalities have used that extensively and they had great experiences with it. So I'm not worried, but I still would like to have that test phase. And if this becomes, you know, for us, clearly, you know, successful, because we see that it really helps to save everybody, the drivers as much as the bikers and the pedestrians, et cetera, that we can then discuss to establish some kind of an ordinance that would require, you know, everything on the island to be done in a certain way, or at certain critical intersections, Sea Marsh comes into mind. Sure. You know, Russell mentioned the Sora Rail and others, or the future setup for the Governor's Drive crossing, you know, before you hit the second gate, going out. So, I mean, this can then all become a question of ordinance, but that's currently in our jurisdiction. We can implement this, test this, see how it works, and then make decisions about ordinance.
Well, what I was thinking is whether or not there is certainly the blinking lights, which are used in a number of municipalities, but tend to be, like you say, more high-traffic intersections, and particularly where there's some speed involved or longer crossings, not exclusively, but, yeah, visibility issues. But there are others where you just have intersections where you have crosswalks, and that in fact, the pedestrians have the right-of-way. The law or regulation is that drivers give way to pedestrians.
Yeah, that concerns me, though. And I bring that up only because I come from New York City. They have the same laws, and pedestrians have the right-of-ways and crosswalks, and they don't give a damn. And we have a lot of New Yorkers and a lot of Northeasterners come on down, and so that mentality is going to still show up here. They see somebody in the crosswalk and they don't care. I'm not trying to be funny or flippant, it's just factual.
I think, Russ, that's where the signs are really important. So you put the sign up that stop, pedestrians have the right of way, those kind of vertical signs.
Well, that's all part of what we're going
I
to do
think
with these
that's-
blinking signs.
That's really
Well,
critical, to
but
have
there
those
is-
signs there.
Definitely
in
is.
But I think
We
what-
are planning on doing that.
What Brad is bringing up is certainly something that we, even independent from the blinking light topic, can discuss. I give you an example. There is the Blue Heron Pond Road that hits Governor's Drive, right? So serving all of the preserve area, right? That's this intersection. A lot of traffic. It's in a curve, and there is, although fading again, you know, this pedestrian and bike crossing over Governor's Drive onto, I guess it's Blue Heron Pond Road. But there's no signage. There's nothing. There's not even a sign.
That's true.
There's just marking on the street, and they are starting to fade very quickly because they were just paint and not this thicker, you know, material that you use, you know, for example, at a store as a stop line at an intersection for whatever reasons. So we could, you know, for example, consider to put in an ordinance that in every of these existing crossings, and there are a few more, some are missing, you know, Sorrow Rail and Sea Marsh, et cetera, but that at those crossings, right, at least signage need to be established.
At a minimum.
And just paint in the crosswalk.
And what Seabrook has done, what I found interesting, they actually have these middle cones now at these blinking crossings, where they actually reference that it is state law that people have to stop.
Yeah, that's the sign that I'm talking about. Coming from California, they have those.
Exactly. They have it
In the
a
middle of the
lot.
road.
Exactly.
And there's
So-
also, just to your point, there's also one at Marsh Island, which is, you know, just right down the road from Blue Heron Pond. It's the same issue there.
So independent from the blinking light topic, you know, that will probably take 6 months plus to experience and to make decisions about how that could be multiplied and should be multiplied, we can already now move forward with some of the, at least with signage requirements for some of the really critical crossings.
Agreed. Yeah, we should enforce that.
So as a Jersey girl, I just have never run anybody down yet.
Yeah.
Is there, totally blue skying it, is there a place, a mechanism by which we could do an ordinance that would stipulate, for instance, that a roundabout would have to be put at an intersection that was particularly complex? So,
That, I don't know if
Yeah.
that fits in with, you know, municipal traffic regulation. That's a good question. That one I don't know.
You'd really want a
But as it
traffic
relates
study.
to the signage, I
Want a
would
traffic study
believe
to
that we could
justify
be
that.
able to
I'm
create
looking at an
ordinance.
intersection that hasn't been able to be fixed for years and years and years, and only gets more complex, and the fact that we all know the one that's, goes off to Cougar after the second at Cougar, that doesn't appear to be fixable, resolvable, regardless of how many eyes have looked at it, how many objections have been raised to it, how many different alternatives have been pitched. Nothing's been done and nothing's likely to be get done. And yet, something should be done
You're
there.
correct. And that's one of the areas I've been discussing with the powers to be of
At
Kika
Kika, and
for
they're,
over a year.
and they're totally resistant. So,
I know.
so I'm just throwing it out there as a kind of a radical approach, but I suspect it can't be done, but.
That's also one reason why I would urge us to bring back the Public Works Committee or council, or whatever the name at the end is going to be, or work group. I mean, I'm not sure it really has to be a permanent committee, because we have a few really relevant road and road safety topics to address, inside and outside the gate. And it would be a good time to do it now, because I also understand that KICA has created, a more broader, scope of a subcommittee of some kind, et cetera, that we could interact with in that respect.
So whether this, pedestrian-related issues best reside in public safety or public works, I might suggest the public safety, but I think you're absolutely right. We need to think about the panoply of roads-related projects that we should be thinking about and planning for. And again, if it's a series of kind of one-off task force work groups, you've mentioned, for example, raising portions of KIP to at least address nuisance flooding issues. One of the things I talked to our head of public works is that this relates to something we can talk about later as a reserve study, is actually Beachwalker Drive is beyond standard lifespan for a road. It's never been repaved, and it's starting to deteriorate, and it's going to get a lot more traffic. That's another one. There's other types of things that we might want to think about. So anyway, Mr. Pramar, you've been very patient.
You're okay. Yeah. Whatever committee is involved in this, I would urge them to revisit the original master trail system in the west end from the utility track west. The rises, the tubes that everyone thinks is mostly about golf, is also about trails. And if we take the one that is closest to the halfway house for the first golf course, where the tube goes through there, that trail system should be reconnected to the master trail system, because people were encouraged to bike or walk through that zone rather than cross over at the utility track at Sora Rail. And so you need to work it out with the resort, but that was part of the master trail system there. Now, the first one that you come to from the gate, that is very underutilized because people don't even know it's there. So they go to Surf Song intersection as opposed to go to that tube and go through it. My only point is there is some infrastructure in place. It just needs to be revisited, probably more properly signed, and develop new muscle memory for how people cross from the north side to the south side. Those are already in place. People just are sort of not aware of it. And I think there are other examples like that. There may be an inventive way to connect the Oyster Rake traffic issue to that western tube that would require some collaboration with the resort.
That's a good thought. I mean, the one that goes after between number 3 and number 4 on Cougar, yes, that's the first. It is not well utilized and marked.
Not a single sign.
Not a single sign.
Nobody
No,
knows
not
where it
one.
leads to, right? And then people make wrong turns and end up on the golf course, right? So another reason why I think a public works committee would be a good way of looking at this.
Let's try to actually invite council members to send to Stephanie and I any kind of public works potential projects, and try to ascertain whether it warrants establishing a public works committee as a standing committee, or there are specific projects that we can identify that some near term, and we can have people focus on those.
So I have an overall question. What
Bufflehead.
Oh, we have signs. In general, it goes back to my original question. There are clear safety problems that we all know exist. We've all tried independently.
But don't you think that with the new board, now in place, setting up, we have, I think, Dwight Williams, who is really focusing on the topic, that our safety committee and I think his committee, if I'm not mistaken, there's maybe a better way of both entities to collaborate on a staff and council/board member level to bring things forward.
Great idea. I hope so. And just not just collaboration, but in some cases, it may just require that, since there's a formality to, either that council call council or a committee there is, sending a communication to the KICA board or to a KICA staff member, we believe these potential action items are things that need to be considered. We'd like to sit down and figure out if there's a way for the town and let's do that. To follow up on that. Because I think a lot of it is just, yes, they're conversations, but they're just kind of out there in the ether. And there's not a specific kind of paper trail and follow-up and establish a timeline.
Okay.
And
Great idea.
if they want to come back and say, we're just not prepared to do that now, then the town can consider its options, whether it can do something unilaterally or not, maybe so. But in
I
some
think we
cases,
should do that.
Just kind of press the issue, as it were.
I'll prepare a draft for you to review and approve.
By the way, I mean, we've certainly heard a lot, both at KICA board meetings and just in kind of other back and forth, the issues, the complex issues around a traffic circle at KIP and Keywood Beach Drive. But it's not that complex. Ultimately, it's a cost issue, and thus far, keep that.
Yeah, and the resort needs to be involved in this also from a financial point of view, et cetera. So I'm not sure that the municipality should do anything about that at the moment. I think KICA should have the lead there. And then the question is, what is really the best solution? Is it a roundabout or not? I mean, that doesn't really fall into our matters. We also don't have enough data, I guess, for that. But I want to come back to these blinking lights. So would we all agree that we should, tell Brian to move forward and not wait for KICA anymore so that we get something installed at that test location before, hopefully, July 1st?
I would.
The mayor, if you would please instruct. Exactly. All right. And I don't want to. I want to make sure that proposal has nothing to do with disrespect to KICA or complaints about KICA. I want to make that very clear. It is a very complex intersection that they have to deal with. But in the interest of safety of our residents and visitors, I think the original idea to do something together at the same time kind of has lost its benefits. So I think we need to move forward.
That
Yeah,
was the right decision at the time, but
I
now
think so
there's a
too.
new right
Yeah.
decision.
Yeah, I would agree. There's an urgency with tourist season coming on.
Further discussion on this topic? The last topic, and I'm not sure that we need to spend a lot of time on this one, and I think we all kind of aware generally where the updates are, but medical service needs, I mean, we teed up a lot of this issue in our discussion of EMS. Just perhaps from John or Stephanie,
where we are with the site plan review with regard to MUSC, and then also the I think, expected revised or new traffic impact analysis, because Seabrook had reached out to us to hope that we would cooperate, and we did have, John had Kimley Horn and Dylan look at both the traffic impact analysis that MUSC had prepared that raised some issues and concerns, and then their own, Seabrook's traffic consultant, Revere, had some issues with regard to that. So maybe just bring us up to date where we are on those.
Yeah, actually, I had communications with representatives from MUSC earlier this week. Essentially, there are two major, what I would say, comments remaining in regarding site plan review. One of them is the traffic study for the encroachment permit pertaining to Kiwa granting access to Seabrook Island Road. They are in preparation of revising that TA. I don't have an anticipated time frame on that. Mr. Daniel Alleman shared it maybe around a 2-week period for them to revisit that traffic study. And then the other outstanding comment just relative to their landscape plan relative to the Healing Garden on site on the western end, or eastern end, sorry, of the site. And so that we've met with the Kiwa Island Architectural Review Board together to review that particular site plan. And so, I'm sorry, Freshfields Architectural Review Board. And we have just essentially punted that back to the landscape architect to allow them to take another stab at some recommendations regarding the number of trees that are being proposed for that area. So anticipate those two comments being worked out in the next 2 to 3 weeks. I do believe that Seabrook Island, based on the revised TIA, may feel more palatable based on what was shared. From my understanding, the numbers were kind of somewhat inflated on the original TIA. So that, fingers crossed, I think that will be the only hurdle of getting us through the site plan review process.
What's the TIA?
Traffic impact analysis, yeah.
Thank you, John. And the mayor of Seabrook had reached out, and one of the council members had previously mentioned it, and said they had all of a sudden red flags were raised regarding this one traffic impact analysis that had been prepared by MUSC, that somewhat surprisingly, usually traffic impact analyses prepared by the developers will almost always show, surprisingly, that there's no adverse traffic impact. This one actually did. So I said, let's make sure that our planning departments are talking to one another, our consultants are talking to one another, make sure we're all comfortable, because this all impacts us as well, because it all goes through a single circle, and it's now town residents and that are going to be accessing Seabrook Island Road and coming into that traffic circle as well. So there's been a pretty good spirit of cooperation there. Sounds like MUSC had told us that they had hoped to put shovel in the ground in sometime later this summer. That maybe, but we're not there yet. Okay. And then have we done the follow-up communication on AirMed? I mean, we had pushed that out to the community, right? Or not?
We pushed it out when it was approved. We haven't re-pushed anything out right now. I'm going to get with Aaron, because I want to get with AirMed Care to see about getting some more additional information. I have lost who our representative is, because it's changed hands, but I do want to, there's been some questions, I think, just from the community. We have new people that moved in, understanding that they can buy additional plan. What does that look like? So I want us to be able to push out just some more
So a couple things in that regard, and invite Aaron's perspective on this and council members. Two things. One is sometimes we just put all of this bundled in the Friday, and there's sometimes a lot of information there, and it just gets buried or lost. In time everybody works through all that. Whether we should start identifying certain things that we are thinking are important for the community to focus on, and sending out singular communications around those issues. And then second, and this relates a little bit to our municipal elections and our relatively low turnout that can be for a number of reasons. I don't know if Councilmember Heidingsfelder had the same experience, but it's still extraordinarily frustrating and alarming when you go around and meet with people, longtime residents, that they weren't actually aware that we were having an election. And the fact is, they're not on IKEA, and they're not signed up to the town's e-blast. And whether there's some things, we just need to make sure we send out in paper form, hard copies and mail to every single resident, so they make sure critically important information is actually in their hands.
April 23rd, Tuesday, something that gave critical information to people riding by who don't sign up to these things, or some other type of active thing.
Yeah, it's not a bad idea.
Is that another public works project?
No, just if you guys want to do it, we just order a sign.
Well.
I mean, we have to find out where we want to place
Yeah.
it. We have our nice, beautiful monument sign, how big, because we talked about that one point, and
I recommended, for example, to put up a sign out there for our January 30th elections, because I was really worried that, you know, a lot of people being out of town, et cetera, not really realizing it. Unfortunately, that was never set up.
The only practical thing I see, I mean, it's a good idea, is, you know, you're driving by at 5 or 10 miles an hour at the one at the front gate, and it's like right there in front of you. This would be, you're supposed to only be going 35 miles an hour. Many people are not actually down to 35 miles. Yeah.
But I think there are other ways of you know, expanding our reach with the newsletter, right? One, I think that Erin and Heather, I think it is, right? Who's your counterpart at Kika again? Leah, sorry. Work pretty well together, but still, we just don't reach enough. But I think there could be, you know, ways of us reaching out and asking them to subscribe. I mean, we all have a lot of email addresses that we can use, and why not making sure that everybody at least gets an email saying, why don't you subscribe, for example, right? We have a lot of emails in various systems of our town, right? From business licenses to building licenses to I don't know what else, that we could use really to stimulate people to sign up, right? Very quick, and subscribing to the newsletter is a very easy thing. Right?
So I have a couple of strategies I was going to talk about for tomorrow's discussion. So do you want me to wait on that? Okay.
We can.
But that addresses
discuss it.
some of the concerns that you have. So.
Okay, thank you. Well, if nothing else, not only are we on time.
So, I'm sorry,
Yes,
so,
I'm
so
sorry,
there
I'm sorry.
there are people that actually told you they were not aware there was an election?
Yes.
Oh, yeah. Oh, yeah. Yeah. I mean, beside the people that did know but couldn't care less.
Yeah, yes, apart from that, but there literally were longtime residents that just did not know.
To change topic just a little bit, since we have still a little bit of time, I wanted to see if we are willing to entertain the following question. Two questions, actually. One, we have a lot of ordinances, rules on this island. And they're good. I'm not saying that they are bad rules at all, but I often have the experience and impression that we are not really good in enforcing them, okay? We have ordinances that relate to short-term rental properties, but not to other properties, although they would be, you know, equally relevant. But because they don't exist, I think also that rental properties often don't comply because they don't understand why their neighbor, and I give you a simple example of our trash bins, right? That the neighbor that is renting has to hide them by ordinance, so that they are not visible from the street and from a neighboring property. The house on the other side is not a rental property, and there is no rule that we enforce. Now, you could say Kika does, but I know that they don't. Okay, so I think I would like to propose that we create a little bit of a small work group that goes through some of these topics that really, relate to our community members, and make recommendations back to council. A, do we need it or not? Two, if we do think we're needing it, are we actually enforcing it in the right way? And C, what is missing that we should enforce that might exist for one part of our owners, but not for others. So just to be at the end also easier in our conversations, because I received phone calls from people that are angry. We had this case a couple of weeks ago because they received a courtesy letter from our code enforcement because there was a bike out or something like that, right? And he was addressed with a courtesy letter, not even a warning or a fine, just a courtesy letter, and he was very upset about that. And one of his arguments that I can understand is in saying, why am I getting this when my neighbor has his bikes out the whole time? And it bothers me for years. So I think there are areas that I believe we can do much better by telling our own resources to look more for that, right? Collaborate with Kika on some of these topics as well, similar to what we talked earlier relating to safety, and just either clean up some of the stuff or be more explicit. Yeah. So
all good points, and as I said at the outset, part of this exercise, and that's a great generic point. Then try to drill in as to where there are some specific ordinances that we actually think are sufficient, where we're simply haven't implemented them or enforced them appropriately. I'm not sure there is that much of that on this particular theme. Perhaps a little bit more on the next couple of themes, or there may be some here. But your general point is a
find an appropriate home for it. So that's why.
It is I think a very, very good one. What we find, and Stephanie and I had a conversation about some of this yesterday, is, and this is kind of aligning authority, accountability, and responsibility, is we have a lot of ordinances. There's been inconsistency not only in enforcing them, but understanding who is responsible for enforcing them. And between Berry Island Ocean Rescue, but also their code enforcement role versus our daytime code enforcement officers, where are we seeing there's some data gathering? I just asked Jan Fox yesterday, and she said the vast majority of the actually citations come from the Barrier Island Ocean Rescue night folks. The vast majority, not as many from the daytime code enforcement officers. We need to I want to get better handle on that data and kind of why that is occurring and who's doing what, and what are we monitoring. We also have a number of our ordinances that simply say the town shall do something, but it doesn't specify who is responsible for implementing that particular ordinance. There are a number of them. There are a bunch of them. And so we then need to have in those instances, it's incumbent on the regulatory body, essentially the town, to then establish rules and regulations. They're under administrative regulations. We don't have any. So in some cases, we actually need to establish administrative regulations in order to be able to decide who is the deciding official. Is it Public Works? Is it Public Safety? Is the town administrator? It is the mayor, or whomever. And then sometimes there's actually policies and procedures. And it kind of runs the gamut. Little things, just like weddings on the beach, but fireworks, but there are a whole host of our ordinances where it simply say, okay, and some of that is discussion for tomorrow, but I think it's a very good point.
This is one point of it, but I also feel that we need to be far more precise in telling the resources we have, day and night, what to look for. I'll give you an example. We're also happy with these 5 vehicles of Kika with the green lights that are circling around the island day and night, right? The interesting thing is when you talk to them, one of those officers in these cars, because I stopped one the other day, what he, or in this case she, is actually doing, right? And we would probably have all assumed that these vehicles are enforcing the rules and regulations that we have on the island. Absolutely wrong. What these vehicles do is they look for, for violations of our contractors. If somebody starts too early, if somebody works after 7 o'clock or 7:30, 7 o'clock, I believe, if they leave material out, if they're parking wrong, if they leave a trailer, they look for these kind of things. They don't look for any other rules and regulation that we have.
I mean, the Kika? Yeah,
Kika ones.
yeah.
So that's not our topic, but I'm just saying, and I feel the same way. Remember the conversation we had the other day about Beach Walker Drive parking, now that the Beach Walker Park season's coming up, right? Stephanie responded, yeah, that's, our code enforcement that we look for it. What is the exact, precise instruction that we are giving to code enforcement to say, you have to drive by at this time and this time and this time, you have to give a warning or a letter? I mean, what are the clear operative rules that we need to give to the people that we pay for a lot to enforce our ordinances?
So, again, all very good points. Some of those conversations are already occurring in staff meetings and following up on that. So there is greater clarity, so we understand who is responsible for what and when. So there is clarity about that, so there's also accountability around all of that. There's been, for example, on the front intersection, I think we both noted previously as to what our role of Tony is, and there's going to be greater clarity about kind of the times there, visibility associated, and then what are the responsibilities thereafter. Same thing, to make sure that we've got appropriate follow-up on regarding Beach Walker Drive and any parking violations there, greater clarity about where we're supposed to be, what kind of code enforcement issues should we be prioritizing on a particular time. But just absolutely spot on points. Anything else? So what I might suggest is we're about 25 minutes early, that we'll actually try to start early and end early, but expand the lunch by. We're going to 12 to 12:30 for lunch. What? Pardon?
Lunch from
It's
12:30 to 1.
What I'm saying is we'll start now, we'll break now, and start at 12:45 and pick up a little bit early. Okay.
Let's give you time, guys.